All right, we have FSSA and Dr. Dan. So the floor is yours.
All right, thank you. I appreciate the opportunity to highlight some of FSSA's successes over the last couple years and to present our agency priorities and budget requests. So I'll start with our mission and our vision. So this is our agency's mission and vision, and I think the first three words of our mission sum up nicely who we are as an agency and our why and what motivates us. And that is to compassionately serve. And we do so to give all Hoosiers an opportunity to live in fully engaged communities and reach their greatest emotional, mental, and physical well-being. This is our organizational structure. And as such, you'll see in yellow, these are the 8 divisions that are within FSSA that help us accomplish that mission. Supporting them are a number of agency directors who oversee agency-wide areas like IT, finance, legislative support. I want to start by highlighting a few agency-wide accomplishments and work that really came out of cross-agency and cross-divisional collaboration. Over the last 2 years, we've been working on how we use the investments that we have received from the federal government to both support the workforce that's been affected by the pandemic, but also to create reforms that will better improve access and quality to home and community-based services, to mental health services, and to child care in a measurable way. Now, one specific area we have demonstrated some cross-agency collaborative success in is in the launch of 988. So prior to July, when we launched this, and really prior to the pandemic, if you were suicidal or having a mental health crisis, your options really were to either reach out through the National Suicide Prevention Lifeline, if you knew the number, or to call 911. And this fragmented system really made it difficult for individuals in crisis to find the help that they needed. So in July, we launched 988, and really for us, through collaboration, by coordinating the way we did training, the data systems that we used, and the IT systems that run the system, we've been able to take the 3 state suicide prevention lifelines and get them working in a way that has shown really substantial improvement. So prior to the pandemic, our in-state answer rates were in the 50 percentile rate, so that the other calls were going to a national center. But through this collaboration, our in-state answer rates now to those 3 call centers are now over 90%. And that is about an 80% increase from our pre-pandemic state. And that is actually even before we bring on 2 additional suicide call centers, which are coming on in the early year, and will add additional capacity, but also the ability to text. Also, we've collaborated as an agency to successfully invest these federal dollars in a way to support child care and home and community-based providers. And these funds have helped support and keep in business over 4,700 providers and their workforce in every county around the state. I'm going to quickly now go through our 8 divisions and highlight a few key successes for each of them. I'll start with our largest division, our Division of Family Resources. With offices in every county around the state, DFR helps determine eligibility for Medicaid, SNAP, and TANF. And critical to this determination is our staffing and support and our central and regional change centers. Now, after a competitive procurement, we changed vendors last year. Changing a large vendor is always complicated, but doing so in the middle of a pandemic is even more complicated. And despite that, we managed to make this transition. We began it in March and finished it in November of this year. And this was done really seamlessly without any disruption of services around the state. This change also has put us in a much better position to meet what we know is going to be the increasing workload with the end of the federal public health emergency. As you all know, the state ended its public health emergency, and with that, DFR was able to successfully unwind pandemic-related SNAP benefits. An area that people may not know that DFR does is in helping refugees, asylees, and certain immigrants resettle into communities. And last year, they were really instrumental in helping the over 7,000 Afghan evacuees that were out at Camp Atterbury. We set up local offices out at Camp Atterbury, and by being there on site, we're able to make sure that for the over 700 evacuees that left and we'll now call Indiana home, that they had the benefits that they needed to successfully integrate into their new communities. The Office of Medicaid Policy and Planning is responsible for administering our Medicaid program. And in the last 2 years, we have competitively reprocured all 3 of our managed care programs. That includes our HIP program, our Hoosier HealthWise, which is predominantly for children and pregnant women, and Hoosier Care Connect, which provides services to Medicaid members who are age blind and disabled. Now, as we brought on through this reprocurement, we brought on a new plan, and through all of those reprocurements, the MCEs had to go through year-long readiness reviews and implementation testing. And we do this so that as we were successful in these, that we were able to do so without disruptions to members or without disruption to services. One thing that would have been incredibly disruptive is last November, CMS came and stated we were out of compliance with our HIP rates. And as such, at the time, was demanding that we would claw back over $500 million from providers. That was not something that we felt was reasonable. We went back to them and instead negotiated a far more reasonable time frame to equalize provider rates across our managed care program, and to do so in a way that did not require clawbacks. Lastly, as part of Medicaid's focus on reducing provider abrasion, we have announced that we are going to a single preferred drug list. Now, once in place, a physician no longer will have to go through 6 separate lists of medications to determine which medicine his patient's managed care entity will approve. And the reason they won't have to go through 6 lists is there will be 1 list, and that will be the list that we create for all of our Medicaid managed care programs. This will be a huge benefit to providers and really, in many ways, I think, exemplifies our commitment to reducing provider abrasion across our programs. Serving as our state unit on aging, the Division of Aging provides critical services and supports that allow aging Hoosiers to stay and thrive in their communities. Now, serving the population that was at greatest risk during the pandemic of getting ill or dying, they, in partnership with our disability division, created a unique Homebound Hoosier program. This was a program that allowed for the administration of vaccines to Hoosiers who could not leave their home. So if they couldn't leave, we brought the vaccine and administered it to them. In addition, in partnership with the Commission on Aging, they have developed our 4-year state plan on aging. And in addition, are partnering with providers around the state with both grants and educational programs to help get them ready for settings rule compliance that is coming up this year. And whether through First Steps, vocational rehab, or a number of our developmental disability services, including 2 waivers, our Division of Disability and Rehabilitative Services is likewise focused on helping Hoosiers thrive in their communities. And through the Hoosier Family First Fund, created by SEA 2, they are increasing access to First Step services by providing higher provider rates. During the last year, they also successfully completed their case management innovation project and were able to do this in a way that did not result in disruption to members. And they've partnered with the governor's workforce cabinet on the combined Workforce Innovation and Opportunity Act state plan. Now, collectively, all of these divisions have been working on how we invest the HCBS dollars that were made available through the American Rescue Plan. You look here on the slide, you'll see a little bit about where those dollars are targeting. So of the $817 million that are available, 78% of those go to support providers and their workforce, either through grants and projects or other supports. And through that, we will be providing additional supports to a variety of populations. So most of the populations that benefit from this kind of fall into multiple categories of home and community-based services, but it also includes some projects on specific populations, including the aged and disabled, as well as individuals in mental health crises. Now, for individuals in crisis, this work has been spearheaded by our Division of Mental Health and Addiction. And along with the launch of 988 in July, they have collaborated with Indiana 211 on the Be Well helpline. This is staffed by trained counselors. We kind of brought this online in the beginning parts of the pandemic, and since has provided counseling to more than 45,000 Hoosiers throughout the pandemic. And along with our work on increasing access to mental health services, in the last several years, DMHA has opened an additional 5 opioid treatment programs around the state, which now brings our state total up to 23. And there's 4 additional programs that will be opening in 2023. DMHA also oversees 6 state psychiatric hospitals. And at the peak of the pandemic, when hospitals were challenged across the state and across the country with staffing, our wait times for individuals who needed care that we deliver in these facilities, individuals with severe mental illness, was as high as 4 months. Now, through multi-divisional collaboration and collaborating with stakeholders, we have cut that time to well over half and are now under 30 days for our wait times. And that means that, particularly for those individuals who are incompetent to stand trial and who need mental health services, they are no longer languishing in jails waiting on treatments, but are rather getting timely services that better help them participate in their own legal cases. I think through DMHA, and I think you all know this well, we have seen throughout the pandemic the greater need for access to high-quality mental health services. I think with your leadership through HEA 1001, we have been able to start to put these dollars in investments that will help provide this greater access. Of that $100 million, $90 million have been allocated already to planned programming, with about half already obligated and executed in contracts. And a couple areas that will spotlight where those dollars, along with other federal dollars, have helped to support. One is on our development of a crisis response system around the state. So a person who's in a mental health crisis often is going to need more than just to call 988. And that's why we've been able to use investments to build out crisis response teams, so individuals that are trained with mental health backgrounds who can respond to those individuals in need. We've also been able to invest in locations around the state where an individual with a mental or behavioral health crisis can get care that is better tailored towards their mental health needs. Really, over time, and as we build this over the next 5 years, this is about making sure that individuals who are in crisis can get the right care in the right location by the right type of provider. In addition to our crisis response systems, we've been investing in community innovation. We've known with mental health that one solution is not going to work for everyone, and that a lot of times there are local needs that are unique, and so therefore we, through our Community Catalyst grant, have partnered with 37 different community groups to develop programs that would increase access and quality of mental health services. And I will say that the Catalyst grants had a unique aspect in that those awardees also brought additional resources and dollars to the table, which allowed us to take roughly a $30 million investment and amplify that to a $59 million investment. And through that also, $35 million are committed to minority-led behavioral health services, services that will help us also address gaps that we know exist across the state in access. Now, the last 2 years have also provided a number of challenges to childcare access. So that's why the Office of Early Childhood and Out-of-School Learning has been focused on supporting childcare providers and families. This support includes employee assistant for childcare workforce, a new partnership with the Department of Education in the relaunch of the Early Learning Advisory Committee, and the distribution of over $500 million federal dollars to support providers and their workforce. And these investments have started to pay off as we've started to look at their impact. Through $79 million in grants through our Build, Learn, Grow grant program, we have been able to support over 21,000 children, equaling upwards of 700,000 weeks of care. We've been able to help keep providers in business by allowing them to kind of reach that critical threshold of 85% capacity and to better retain their own workforce, as we've seen with a reduction in the number of open early childhood positions. Another division in FSSA is our Disability Determination Bureau. This division makes key medical determinations that help individuals with disabilities get much needed Social Security benefits. And in the last year, they have launched a new case processing system. Anyone who has been through a large IT system change knows how difficult that can be. But to go through one in the middle of the pandemic is also difficult. And DDB really operates predominantly with FSSA-related systems, and so we don't have as much control over the systems that we use or when we implement them, but we do have control over how we implement them, and incredibly proud of how they were able to do that and not only meet their state goals, but actually exceed them. And then Indiana picked up cases from other surrounding states to help them achieve their final year goals. They also are really leaders within our agency and investing into their workforce through training and professional development and investing into their local communities. Our last division I'll mention is our most recent addition, and that's Indiana 211. As you know, they became part of FSSA in 2021, and I think, as you probably also know, have made a pretty substantial and immediate impact. The role really is to connect Hoosiers to community and state services that individuals need to help us meet our agency mission. And as part of that core function, the community navigators in 211 have taken over 400,000 calls in the last year. In addition, 211 became a really critical partner for our state's COVID-19 response. They became the one resource for the community for any questions related to COVID, if they needed help scheduling or rescheduling a vaccine appointment, or if they needed help getting tested. And in that role, 211 has taken over 1.3 million COVID-related calls. Now, as we're moving out of the pandemic, we're focusing now on fully integrating 211 into our divisions and creating partnerships within division or within FSSA, but also across the state. We have partnerships with the Housing Association and partnerships with Department of Health that we will continue to work on. So now that I've talked a little bit about what we've accomplished, I want to take a few minutes to talk about our agency priorities for state fiscal year 24 and 25. When systems are put under stress, particularly when they're put under severe stress, you tend to see where the cracks are. You tend to find the leaks. And the last couple years have put our systems that we oversee under tremendous stress, and as such have really shown us where we have system-related challenges. We saw this in our public health infrastructure, and with an FSSA, we've seen this in how we care for aging Hoosiers on Medicaid, and in the access and quality of mental health and child care services. Now, when you have a crack, you have two ways you can respond. One is you can patch it, and you can hope that you don't put that system under stress again. The other is you can rebuild it. And you can do so in a way that makes it stronger and more able to withstand not just the stress it went through, but an even greater stress. And that is really what we're interested in doing. We're interested in rebuilding and working towards more resilient aging mental health and child care systems, work to make them stronger. Now, the goal in our aging reform is to assure that Hoosiers have more choice in where they age. Since we know that when asked, over 75% of individuals who are over the age of 50 state that they would prefer to age in their home, our goal is to design a system that better allows them to make this choice. And as we've discussed with you all in the past, to accomplish this really requires a reform of the whole aging system, not just one part of it. Requires us to change how we do eligibility, how we do and simplify care coordination through managed care, how we pay for outcomes and not transactions, how we have better integrated data systems that allow us to better see what members' services are getting, but also how our providers and us as the state are performing. It requires us to support the workforce that will be needed if we want individuals to stay in their home as the population continues to age. It will also require us to create a roadmap for home health and how it integrates across our programs, and how we better integrate the waivers we have in the Division of Aging with those in our disability division so that we create a better continuum of care for individuals with physical disability. It also, for us, will require us to continue to invest the federal dollars that we've had on building these programs, but within this, we'll also have change requests that will better assure our readiness review of the managed care entities that will come online for the MLTSS program in a way that makes sure that it's seamless for members and for providers. It also allows us to have better staffing and oversight and operations of this program, and will adjust our choice transfer to better allow our Division of Aging to really turn its focus towards non-Medicaid programs. Another area we're reforming is our mental health and behavioral health systems. As I've mentioned, the increased demand created by the pandemic has shown the need for making it easier for individuals to get the right care and the right type of provider and in the right location. And the populations we're really focused on are individuals who come into crisis, specifically justice-involved individuals, children, and folks who are at risk of suicide and self-harm. Now, accomplishing this will require payment reform by moving to our certified community behavioral health model. It will also require us to decrease the time it takes for an individual who is in jail to get treatment that allows them to participate in their trials. It will involve increasing our mental health access for children and building on the launch of 988 by investing in crisis response and crisis treatment locations. And while we will use federal dollars that we have allocated to build these systems over the next biennium, I think it's also really important for us that we begin the conversations on how this work is going to be sustained beyond that biennium and into the future. Our third area of focus is on expanding access to and the quality of childcare. An important first step in that work came from last year's HEA 1093, with the recreation of the Early Learning Advisory Committee and the creation of the new Office of Kindergarten Readiness and Department of Education. And now those entities with our Office of Early Childhood Care really are collaborating in a way that we haven't before to look at and to develop a plan for how we reform our child care system, and specifically looking at areas around eligibility and how we might make more families eligible for subsidies, looking at the regulation and licensure aspects and how we can simplify that and reduce provider abrasions to get more providers to go into childcare. Looking at specifically how and what we're paying for in childcare. And lastly, reevaluating our quality systems in a way that better aligns with kindergarten readiness and other programs. So our change package does include an increase in state appropriation to leverage an increased amount of federal dollars that have been available over the last several years. There was not a state match. This would allow us now to continue to bring in that additional $10 million federal dollars, which would allow us to continue to support families and make sure that we don't have a wait list, which we don't currently. So here is a snapshot of our state fiscal year 2023 funding. Such it was upwards of $20 billion between federal, general, and dedicated funds. And here is our budget request for 24 and 25. I'll mention that this does not include the Medicaid forecast, which will be presented to you all tomorrow. And earlier I highlighted a few funds in a few of our agencies in aging, mental health, and childcare. I will take a couple of minutes to go over some additional change package requests that we have. One includes dollars to support 211 operations now that they're fully integrated into FSSA. There are funds to make sure that our state psychiatric hospitals have the clinical staff that we need to assure that our wait list times are appropriate, and funds for ongoing operations of our DFR eligibility systems and supports in our change systems, including our IADS eligibility, single eligibility system. Our change package request also includes funding for Medicaid operations. This includes IT and data system support, improving our prior authorization system in the fee-for-service program, and developing a systematic approach to regular provider rate reviews and updates, an approach that would allow you all and providers to have better predictability at when rates would be evaluated and reconsidered. And as part of our matrix work, we are evaluating currently home community-based and home health rates, and that work will be reflected in the governor's final budget. And lastly, in Medicaid, as I think Director Stignan discussed earlier, is a request for funding for DCS to continue to be able to provide Medicaid services to children in QRTP facilities using Medicaid 590 program. Lastly, our change package request includes our administration appropriation, ongoing First Steps funding, and adjustments for the impact of the compensation study. It also includes adjustments that you'll see on the opioid settlement fund, which will largely be front-loaded and with subsequent years with lower amounts of dollars. So with that, as always, we're happy to take questions either through email. I think you all have, you know how to reach out to Gus, but obviously with the time we have today, happy to address any questions you have.
I just have one. So let's go to the long-term care, page 21. You know, I sat through long meetings with you guys on this, and you know, I thought one of the main points was it was going to save us money by going to managed care, but yet I'm seeing increases in here of $5.5 and $7 million and then 1.4. So if the goal was to reduce the cost, why do we need more money?
Yeah, to move, part of this is dollars invested to move towards managed care. The savings really are after that program is implemented, specifically as we develop a system whereby more individuals are able to stay in their homes longer. Those are where the cost savings are. So there are some upfront investments to both launch this program, but really it's around diverting dollars down the road.
Because when the bill was recommitted in the Senate last time, or last year, it was mentioned, why is it recommitted? It's not going to cost us anything. So it really is going to cost us something, though.
Yeah, there are going to be costs in operating the program.
Thank you. Questions? Senator Brown.
Thank you, Mr. Chairman. So just to be clear, looking through some of these, since it's in different areas, the A&D, the TBI, across the board, you're asking for increase in reimbursement rates to providers?
Our rate review for HCBS providers that we're doing right now includes all HCBS providers across those programs.
So you're doing a rate review, but not a rate increase?
The rate review, as we work with providers, will bring back recommendations for rates that need to be in place to help continue to support them in their ongoing operations. So that work is ongoing right now, so I don't know what the number is.
Okay, because the last time we went through a budget cycle, I'm sure you're aware, you left out two categories of providers, though, for the A&D and the TBI, which was disturbing to me to think that we had increased all of the rates because they all needed a reimbursement rate increase and they didn't receive it.
Yeah.
So
No,
hopefully if a group, so to speak, a provider line is left out, you will notify me of that and why.
Yeah, I think that's an important point, and it highlighted, like, this is why we do this collaboratively and why we've been working with the provider community over the last year, so that we don't end up with rates that disproportionately affect one of the HCBS provider populations, but rather we are able to get all of their input and do that. Because if you target one area, you'll just shift more care to that area. So this is why we're doing it more collaboratively.
And is there a possibility that the rate review will result in an indexing process going forward?
You mean indexing to, say, Medicare or some other right there?
Yes.
I don't know whether or not that is part of the recommendation at this time.
Okay, and with respect to credentialing, that's been an ongoing issue in my community.
Yeah.
Do you have any sense of how to streamline that?
Yeah, that's a great question in terms of, I assume you mean provider credentialing. Are you specific to Medicaid managed care or to just Medicaid?
You can pick.
So, yeah, so for us in ICB, that's where really looking at how we, with our provider relations team, do a better job of working with providers in the community to make it easier to get them credentialed. And so a lot of that is really communication. How do they know who they can reach out to in our teams? Now, when it comes to managed care, that is really around how do we take the 5 plans that we have and in many ways through our contracts and our readiness review, hold them accountable for making this easier to get providers in and making sure that providers, when they're having difficulty, that they know how to reach out to us directly so that we can intervene.
I guess I know when I was on the Medicaid Advisory Committee several years ago, there had been a push by FSSA to have a portal, which you spent some money on in IT and abandoned. And so I would like to see more of a push towards a default process, particularly with our compact licensing and reciprocity bills that have passed. If a provider is credentialed with one of your plans, it should by default be credentialed with all of them unless we hear XYZ, right? Because you know these people are, we want them to come to the state. We need healthcare providers across the spectrum, and yet they get here, they've been moved here, and they can't be reimbursed for their services because there's a logjam going through your agency. So that'd be great if you can speed that up. And then with respect to the hospital assessment fee, is that adequate right now as it complements the increased Medicaid dollars that we pull down?
Yes, I mean, right now, each fiscal year, we look at the cost that's covered by the hospital assessment fee. And yes, we do have the adequate fees to be able to cover those costs as we move forward. And that's what you'll see tomorrow that's built into our Medicaid forecast. Anything of those increases, like under HIP, would be covered by those hospital assessment fees.
Okay. And then, thank you. With respect to Be Well In, does that also include telehealth type of services?
It probably depends on how you define telehealth. Be Well is a phone service, and so there's not a direct video link with the Be Well helpline, but telehealth is something that we substantially expanded through Medicaid programs and have done in partnership with things like our community mental health center. So we are paying for more telehealth than we have ever done before. But the Be Well line specifically is a phone line.
Okay, thank you. And then two more questions, and you can get back to me later on this one. My understanding is that you are calculating a 50% spend as we transition to managed care, well, from the 75% spend we have on long-term. In other words, we're going to shift. We're going to save money. And going to piggyback on Senator Mishler's question about not seeing the savings, particularly because you know, and we know, we've had this conversation, we don't have the workforce for home-based community services in the managed care that you're looking for. So you can get back to me on how you're improving that workforce, because what I'm seeing, I noticed in one of your, maybe not in the slide, in the materials you sent, you're also looking at transportation, and I can't say that I've seen a solution, a good solution to that in my community, having met with a lot of providers in the last few weeks and months. Many of them have brought the transportation in-house, so you're not paying for it. We aren't paying for it, and they're paying for it on their own dime and not being reimbursed for that. So I put that out there to say, if we're going to start requiring that, which I understand is in the RFP, then it should be something that is also reimbursed to the locals. Thank you.
Thank you.
Rep. Porter?
Thank you, Mr. Chairman. Mr. Secretary, thank you. On page 26, and talk about additional, excuse me, agency change packages. So you're asking for more money, particularly for DFR. That's, 20 million in 21 over the 2 years, 24, 25. Tell me why you're asking for that, and is this part of a program that did not work well in the modernization that we're trying to do 2 years ago, or what?
I don't know that I have the institutional knowledge on that, but it is in part two things. One is it's connected to both moving towards better staffing and support in our DFR facilities. So whenever you do a reprocurement, there is always going to be some costs that increase, but some of that cost for this we know is going to really be around having enough staff in facilities able to answer questions when folks are applying for a variety of our different programs. So some of those costs are in there. In addition, some of it is around systems in those to make sure that we, get the information we need to be more timely in how we respond to individuals who are coming in. So I don't know that any of it goes back to the IBM days, but it's certainly, when we look at over the last 6 years and what we need to improve the performance in our DFR offices, includes both the staffing and system supports we'd need for that.
Thank you, Mr. Chairman.
Anyone else? Senator Cadora?
Thank you, Mr. Chair. Thank you both for your service and for your agency. Your team has been very responsive to many of my emails over the last few months. I have a couple of quick questions. The Crisis Intervention Training Fund that we created last session, but we're waiting until the appropriation session or budget session. Does your budget proposal contemplate adding any dollars to the Crisis Intervention Training Fund?
No, I don't.
We haven't added any additional ask for that.
Great. That will be one of my list of things for this upcoming session. This is a fund for law enforcement and first responders to complement the 988 system, because if we have a 988 system and first responders are not even trained of how to deal with patients who have behavioral health issues, then it will not produce the results we're looking for. I suggested to start with $2 million last session and $50,000 grants to law enforcement and first responder agencies across the state. Second question, does your budget contemplate funding the 988 system?
Our budget does not. We're using federal dollars over the next 2 years to invest into the building out of that system,
Correct.
but our budget does not include ongoing operational
Because
costs.
the initial $100 million from the American Rescue Plan dollars were the dollars that were supposed to fund the 988 system and all of that. I know that in the behavioral health report that was published recently, there were a couple of suggestions of how much we are losing in economic productivity, 4.2 billion, I think, due to untreated mental health issues in the state. And I know that Senator Kreider has been leading the effort on this, and I'll be supporting his effort. But I thought we will be looking at least at, $50+ million increase annually in funding mental health, which is not reflected in this proposal. My third question, the early learning investments with the American Rescue Plan dollars you received, I think, north of 540 or $540 million. Your presentation shows that you spent almost $508 million. What was the result of that spending? What metrics do you, I know there was a slide that showed, 700,000 weeks of care and all that, but it only showed $79 million that were invested. The $508 million, what results did we get as a state from spending the $508 million?
Yeah, a lot of those dollars were targeted specifically at both providers and the workforce so they could stay open. So when we looked through the pandemic at a time where if you were a child care provider, children went home and much of your workforce went home as well. So part of that was could we keep providers open and doors open so that as the pandemic eased off and individuals went back to the workforce, there was appropriate child care providers. And so there's a recent report that came out nationally that highlighted states. We were one of those states that highlighted, because when we look at our child care providers compared to other states, they have had to invest less of their own capital to stay open, in part because how we directed those federal dollars. So to be honest, I think the single best metric is just the number of child care providers that are still in operation.
Just to keep them open, which is a noble mission.
Correct.
I'm very supportive of. I introduced legislation to use a strategic plan for child care to address this across the state. I'll continue to advocate for this next session. On the CCDF funds, the Child Development Fund, you're asking for almost, 5+ million, $5.8 million. What is the wait, how many people are in the waiting list to send their kids to, do we have?
Currently right now, I don't think we have anyone on the wait list.
Okay. No, because you mentioned earlier a wait list, so I wasn't sure.
Well, in part, we've had increased federal dollars over the last several years, and I think those dollars we've been able to utilize to make sure that people aren't on the wait list.
Correct.
Now that the state
federal
match is required for that, this will allow us to continue to receive those dollars in a way to support families and kids.
I'm working with Gus on scheduling a meeting with the early childhood and learning folks in FSSA. But I'll tell you that we have to advocate for both the CCDF expansion and early learning on my way to pre-K, because if you expand only the on my way to pre-K, then you're only creating a more expensive system that does not necessarily translate into more kids going from childcare into on my way to pre-K. So we must expand both to expand the capacity of the providers of the system and the scholarships. But I'll be reaching out and working with Gus on this in the coming weeks. Home health, your presentation mentions that there's a plan, and I think the governor's budget will include the recommendations for increasing home health rates. FSSA has been very responsive to concerns of my constituents in my district. The issue is above and beyond FSSA. However, we still have a crisis. So one of my constituents literally called 79 social service agencies. I shared the list of agencies that they called with FSSA. Within 24 hours, FSSA was very responsive, reached out to some of those and tried to help, but there was no capacity in these home health providers to take a severely disabled child. One of the parents have to give up their jobs to stay at home to take care of the child, so they lost half of their family income. And that's one of tens of cases in my district alone. So I really appreciate you working on the home health rates issue for both the waiver and non-waiver programs. It's a critical issue to work on. So thank you for that. I look forward to looking at the agency's budget. My final question is in relation to the feds talking to FSSA about the HIP rates and looking at the areas such as pediatrics, dental versus the adults and so on. I appreciate your work on helping the state not go through clawing back $500 million from the providers. The concern that I'm hearing from the community is that you're trying to equate the rates for the adults and the younger population, the children, which is going to translate into a reduction of benefits for one of either population. Can you clarify what is that negotiations looking like? And the reason I said for one of the either population, because I heard contradicting information about which population will see, the adult population or the younger one will see reduced benefits. So can you talk a little bit about that,
Sure.
please?
It's like all things in healthcare, it's complicated. So it depends a little bit from it, because to some extent, we're talking about individual providers, because those are the rates that are going to be affected. So it depends on an individual provider's patient mix. So if they have a lot of folks on HIP, then they're going to potentially see rates decreased if the place we land is kind of equalizing rates across of them, kind of in between the HIP rates and the current rates in our other programs. But if they've got a patient mix that has a fair number of folks on Hoosier Care Connect or a fair number of folks in Hoosier HealthWise, then they may see a rate increase because those rates would have to come up to kind of hit that meet in the middle approach. So it's going to really depend on each of their kind of patient mix as to where they're likely going to land. And that's why it's kind of hard, because we see kids in HIP, we see kids in Hoosier HealthWise, we see them in Hoosier Care Connect, and same with adults across those programs. So that is why in the end, the goal of trying to create something that I think creates equal provider rates across those programs, but also is sustainable from a state standpoint. I think it's important that we do so in a way that, again, keeps in mind some of these potential unintended consequences. Again, we'll be doing a lot of outgoing and stakeholder work with individuals. I know we've worked with a ton of folks, dentistry and other folks already who brought forth concerns.
I appreciate you. For legislators like myself, it's difficult to go back to my district and tell people the state is taking benefits away from you. Yep. They don't understand. Not everybody sits down to fully understand the nuances of the complexities of healthcare or federal versus state funding. I fully understand the fiscal responsibility piece, and we have to be fiscally responsible, but I urge you to do everything in your capacity to come up with a solution that maximizes benefits for all. One solution that was suggested to me on the home health care is that you pay parents of children with severe disabilities under the age of 18, children under the age of 18, you pay them to take care of their kids at home. So that could be one solution that can help you with the workforce issue in the short term. Again, thank you for your service. I appreciate the work that you do, and I look forward to continuing working with FSSA. Thank you. Thank you, Mr. Chair.
Anyone else? All right, thank you.
Thank you all.
Next, do we have Department of Health, Dr. Box.
Good.
Support staff there. Have you ever sat there and looked this way?
No, not for a long time.
Maybe hard to keep him quiet.
I think this is the first time I've ever seen him on the other side of me. I'm usually right beside him. Floor is yours, Dr. Box.
Thank you, Senator Mishler, and thank you for this opportunity to present to the State Budget Committee some of our agency priorities in the work, along with our current projected budgets. The Department of Health is celebrating 140 years of promoting, protecting, and improving the health and safety of Hoosiers. Our first meeting was January of 1882. Our executive team consists of myself, our Deputy Health Commissioner for Local Health Services, our Chief of Staff, sitting beside me, our Chief Medical Officer, our Chief Communications Officer, our State Epidemiologist, and 4 Assistant Commissioners. These commissions include our Health and Human Services, our Consumer Services and Healthcare Regulation, Lab Services, and Public Health Protection. This slide gives you a better idea of how we are structured. We revised our organizational structure in October for better capacity to meet the needs of recommendations and outcomes of the Governor's Public Health Commission. Specifically, we placed Pam Pontonis, our longest executive at the Indiana Department of Health, in charge of local public health services, and Amy Kent will be moving from our regulatory consumer services, in which she was the AC, to our Chief Strategy Officer to lead implementation of large Department of Health programming. As you know, Governor Holcomb has made addressing infant and maternal mortality a top priority for our state and for our agency. Indiana's lowest recorded infant mortality rate since 1900 was in 2019 of 6.5 infant deaths per 1,000 live births, and this amounts to 527 babies that died before celebrating their first birthday with their family. This was down from our 2016 infant mortality rate of 7.5 infant deaths, which for comparison was 623 babies, so almost 100 more babies. Most encouraging was the decline in our Black infant mortality rate to the lowest it had been for 10 years. Unfortunately, over the past 2 years, we have seen an increase in our Black infant mortality rate again to 13.2, and our Hispanic infant mortality rate this past year went from 6 to 8.1. Therefore, we, according to our preliminary data for 2021, will again see a slight rise in our state infant mortality rate from 6.6 to 6.7, which is 14 more babies who died before their first birthday. The recent increase appears to be secondary to a rise in preterm birth rate, which is the #1 cause of infant mortality for the state of Indiana and really across the United States. According to the March of Dimes 2021 data, nationally, the preterm birth rate is going up with a significant increase of 4% in just 1 year, and that's the highest recorded rate for them since 2007. Indiana's maternal mortality review has now completed a review of all maternal deaths for the years of 2018, 2019, and 2020. This amounted to 215 pregnancy-associated deaths over that 3-year period of time, women who died either while pregnant or in the first year after the delivery of their baby, or the end of their pregnancy. Using combined data from these 3 years, we see that Black non-Hispanic women have the highest ratio of pregnancy-associated deaths and pregnancy-related deaths. Review of the 3 years of data show that 31% of those pregnancy-associated deaths were secondary to overdose, and over 50% of those deaths had some component of substance use disorder or mental health issues associated. The most common cause of pregnancy-related death is hemorrhage and postpartum cardiac issues. Obesity was also found to be a contributing factor in 11% of those deaths. Review by the committee of the 3-year data determined that almost 80% of these deaths were deemed preventable, meaning that they either had some chance or a probable chance to alter the outcome. Our OB Navigator program, known as My Healthy Baby, went live in January of 2020, and we continued to move forward with this program and roll it out to counties throughout the pandemic. We will be live in every county by May of 2023, such that every woman that is covered by Medicaid who desires to be connected to a home visiting support provider or family support provider will be able to be connected. The goal is to connect pregnant women to a family support provider or home visitor to support women through the pregnancy and at least the first year of the baby's life, connecting them to prenatal care earlier in pregnancy, and wraparound services such as mental health and substance use disorder support, and support to alleviate those socioeconomic factors which become barriers to prevent women from getting into care early and remaining in that care. My Healthy Baby funds are $3.3 million per year, and you can see we are spending that each year. We do use Medicaid match whenever possible. The funds have been used to support the local home visiting programs to expand and to train their personnel, and also for data and technology at the state level to track the percentage of women that we are able to reach and who accept that referral once we reach them. Also, we have funded the Moms Helpline to call women and explain the program and offer connection to home visiting programs. And you'll see a slight increase in that budget because we've actually expanded them into the evening hours and expanded to multilingual access. Importantly, FSSA will be using some SEA2 funds to explore the sustainability for doula programs and federally recognized home visiting programs like our nurse family partnerships and healthy families. You can see here the home visiting programs are a mix of nationally recognized models like Healthy Families and nurse family partnerships, and also state models like our community health workers, our hospital or health department base, many of which are funded by safety pin dollars. My Healthy Baby brings these programs together under one umbrella for our state. Ongoing funding for the programs highlighted in blue is a mix of federal, state, and local dollars, including MCV, which is Maternal, Infant, and Early Child Home Visiting, Title V, TANF, state NFP funding, and safety pin dollars. Continued funding will allow us to ensure the maximum number of families can be served. For now, it's truly exciting to see how these funds and investments in home visiting are working together to create a network of support across our state and connecting women to these services. Expanding funding from the special session this summer was allocated the expanded funding to $10 million to expand nurse-family partnerships statewide, and this was increased from a baseline of $5 million per year. $5.5 million for Safety Pen to provide women's health and OB services closer to home in counties without inpatient OB services, and this was increased from a baseline of $5.5 million per year. And $2 million for Real Alternatives, which was an increase from $2.495 million per year. This chart shows you the funding received by NFP across the state of Indiana and the funding source and the numbers of families that will be served. The map shows you how, with additional funds provided this summer to Nurse Family Partnership, we'll be able to expand this to cover the entire state, including the expansion of the number of families served. The existing Nurse Family Partnership providers will either be expanding to cover additional counties and/or additional clients. For instance, Healthier Moms and Babies, which is in Northeast Indiana and Allen County, the Blue Hatched County, will be adding 9 additional solid blue counties that they cover. And IU Community Health in the pink will continue to serve the counties that they have already been serving, but they will increase their staffing to see more clients. Our Safety Pen funding has been used to fund evidence-based programs for parent education, safe sleep promotion, fetal infant mortality reviews, doula services, and other home visiting programs like our Pre-to-3 program in Vanderburgh County Health Department. We also piloted a program in 2021 and 2022 to be able to expand access to prenatal care closer to home for pregnant women who actually live in counties without inpatient obstetrical services. You can see the 4 entities that were funded in this program. Unfortunately, the number of counties not providing access to inpatient obstetrical services continues to increase. We will now have 36 when Lawrence County closes its inpatient OB services on the 16th of this month. The 4 entities which received grant money funding to provide OB clinical care in counties without inpatient services are marked with a blue star on this map. The counties that they serve are marked with yellow stars. Gold counties have hospitals with inpatient OB services. Dark gray counties have no hospital, and there's 17 of those. Light gray counties have a hospital that does not provide inpatient OB services, and there's 19 of those now. Through this pilot program in 2021, 3 hospitals and 1 community health center were funded in counties that have inpatient OB services at their hospital to hire an APRN or a nurse midwife to go into counties that do not have inpatient services and provide obstetrical and women's health care closer to home. The funding totaled $1.5 million for over the 2 years, and all 4 of the funded entities are continuing these programs after their grants end this month. You can see some of the successes noted, and we plan to use the new Safety Pen money from special session to expand this program to other counties in early 2023. And in addition to OB care, we will be asking those providers to provide full spectrum women's health care, such as pap smears, referral for mammograms, and contraception. The Indiana Department of Health, in consultation with FSSA, received $50 million to address health issues and challenges here in the state of Indiana from our legislature. The first round of grants were completed in 2022, and $38.5 million were distributed to 120 organizations for 147 programs. You'll be able to see the distribution across the state and the buckets that were funded on the next slide. Round 2 will distribute the remaining $7.9 million balance, which will be awarded the first quarter of 2023, and we're currently reviewing 154 applications for this funding through the end of this month. This slide shows you the number of awards given in each category and the map distribution of those awards across the state. Through discussion with Secretary Rosiniak and his team, and I know I just heard the Secretary present on this, because of other funding already available for mental health and behavioral health, it was felt to be more prudent to dedicate these funds to other health challenges here in the state of Indiana. Now for the topic which I'm sure you are all expecting me to talk about, the Governor's Public Health Commission. This was established, as you know, by executive order in August of 2021 and co-chaired by our former senator, Senator Kenley, who's with us today, and Dr. Judy Monroe, who is a former state health commissioner under Governor Daniels. I think it's important to start with the why that we felt the Governor's Public Health Commission was important at this time. Clearly, the pandemic highlighted the needed improvements in public health across the state of Indiana. In a recent study in 2021 in the U.S. News and World Report called Best States, Indiana ranked 32nd. Above on the left, you can see that we ranked well in our pre-K through 12th grade, as well as economic growth and growth of business, showing that when Indiana invests its time, funding, and resources, we can and we do move the needle. But when you look at the 2021 Americans' Health Rankings, Indiana did not fare as well. We ranked 45th for smoking and tobacco use, 46th for obesity, 43rd for mental health, 41st for childhood immunization rates for children under 35 months, and 45th for state public health funding. In previous years, we've ranked 48th in public health funding, but in recent years, the legislature's investment in maternal child health has improved our ranking. Many Hoosiers are aware of our poor health metrics, but we are finding that many are not aware of our decreased life expectancy here in the state of Indiana, and that has been decreasing since 2010. In fact, our 2019 life expectancy, chosen to be pre-pandemic for obvious reasons, of 77 years places us almost 2 years below the U.S. average, giving us a rank of 40th in the nation. Important to note on this graph is that it's not always been that way. If you look back into the early 60s, Indiana's the red line there, and we were actually above the U.S. average, and we actually ranked 18th in the nation for highest life expectancy. In the early 90s, we began to diverge from the U.S. average, and you can see our decline has further expanded that gap more recently. More importantly, the life expectancy of our 65 and older Hoosiers has actually been increasing. It is the life expectancy of our working age Hoosiers, ages 25 to 64, that has been declining. Even more concerning is the disparities in the life expectancy across our state, which you can see in the map on the right. The difference between the county with the highest life expectancy in the state of Indiana and the county with the lowest life expectancy is almost 9 years. As you review the map, you will see that it is our rural counties that many times have significantly lower life expectancies. From information gleaned from research on 6 different work streams, we developed 32 recommendations to improve public health in the state of Indiana. Those 6 work streams included governance, infrastructure and services, public health funding, workforce, data information, integration and analysis, emergency preparedness, and childhood and adolescent health. To understand the recommendations around increased public funding, I think it's important to understand our current funding structure. We used pre-pandemic numbers because the influx of federal monies during the pandemic is not an accurate representation of ongoing public health funding year after year. According to Trust for America's Health, Indiana in 2021 ranked 45th in the nation for state government public health funding. Most of our public health funding comes from the local government, oftentimes from property taxes. With 64 counties being less than 50,000 and 30 of those being less than 25,000, it's easy to understand the disparities that exist in public health funding when we compare a county of 16,000 to a county of 200,000 or over. The average per capita local health department revenue shows that 90 of our 94 local health departments, and you can see this on the graph on the left, actually have a revenue that is less than the U.S. 25th percentile. The funding ranges from $1.25 to $83 per capita here in the state of Indiana, and the 83 is the Marion County Public Health Department associated with Marion County Health and Hospital Corporation. Current statutorily required local health department services are listed in categories on this slide. According to the Fairbanks School of Public Health December 2020 review of Indiana's public health system, local health departments provide about 50% of recommended public health services. When the commission looked at the future of public health in the state of Indiana, there was a unanimous agreement that additional public health funding would allow consistent delivery of these core public health services across the state and ensure that these statutorily required services are being delivered in every county consistently across our state. We felt that increased coordination at the regional and local levels, and heard this clearly from our local public health people, and the potential resource sharing across counties can be facilitated with additional state support at the regional level to our local health departments. And there was overwhelming belief that services best support Hoosiers when they're delivered locally. Within these areas, specific expectations were outlined that local health departments agreed, and we worked with our subject matter experts at the Department of Health with our local public health people over about an 8-week period of time, and that they felt with increased funding and resources they could provide these. It's important to note that local health departments are not required to perform all of these, but would be expected to ensure that these services are available in their jurisdictions if they accept the governor's public health funding or the additional funding. For instance, they could work with a federally qualified health clinic, a community health clinic, a hospital system, or a community-based organization. We heard clearly from local public health that they need increased funding, but mostly they need to make sure that that's stable and recurring and accessible to them. We've recommended an increase on average of about $30 per capita at the local level. We believe that there's not a one-size-fits-all approach and do not intend to dictate how the funding is spent by each county to achieve these core public services. But we do believe that flexibility will help the community to meet the needs and to help prevent duplication of services. Potential funding uses would include school liaisons, full-time public health nurses, and other staffing needed to meet these core service requirements. There may initially be some purchase of equipment and technology and security upgrades that need to occur at the local level. Local elected officials, importantly, are felt to be important partners in their jurisdiction, and we want to make sure that they have the opportunity to opt in to this additional funding and agree, therefore, to provide the additional core services. A county opt-in will include performance measures and metrics for tracking the delivery of these core public health services. Counties that opt out will be able to opt in in the next year if they desire, and opt-out counties will continue to receive the same level of funding that they would have received prior to Governor's Public Health Commission. So there's no punishment or loss of funds there. The Indiana Department of Health will also provide technical assistance for local health departments to optimize revenue coming into the local health departments, which could include additional grant funding or billing insurance. We're recommending a phased-in funding to allow the build-out of infrastructure over year 1 and year 2. We have developed a state funding formula which delivers $26 per capita for every county or municipality that opts in. Each county and municipality which opts in will be required to provide maintenance of effort with local cost sharing of at least 20%. The formula also takes into consideration counties with higher social vulnerability indexes and lower life expectancy and adds an additional $3 or $5, depending on the number of years lower the life expectancy is from the Indiana's average life expectancy or the higher quartiles social vulnerability index. We also took into account that our smallest counties would need some baseline funding to be able to provide the resources to accomplish these required core services. You will note also that we have requested additional funding for the Indiana Department of Health to provide regional support in the north, central, and southern regions as shown on the map. These additional staff will provide expertise available to our local health departments as they address these core service areas. These additional staff report to the Indiana Department of Health and serve as support for our local health departments. They do not direct the work or do the work of our local health departments. The Indiana Department of Health will work with local health departments to develop and publicly report on key performance indicators for each of these core service areas. Now the important slide. Governor's Public Health Commission funding is as follows. Funding for the local public health, you can see is direct funding to the local health departments through the Indiana Department of Health. It'd be phased in year 1 and year 2 at $100 and then $200 million. There's also some state-level Governor's Public Health funding required to support the regional staff and to support local health department services, and to support our data analytics and making sure that that data is secure. Public health and healthcare workforce planning to include a school nurse liaison and additional support, and then oral health program, which the commission felt was important to reinstitute the screening around the state or the offer of that screening. In emergency preparedness, the pandemic highlighted several areas of emergency preparedness which need to be improved for our state. The first is the state strategic stockpile. The National Strategic Stockpile was never designed to meet the need of every state at exactly the same time. And so we are committed to having a state strategic stockpile with personal protective equipment and medical countermeasures with a life cycle management program to make sure that that does not expire, and to be available for the use of the state in the event of the next public health emergency or, more likely, a medical response to a national disaster. Our trauma system improvement, trauma, as a lot of Hoosiers don't realize, is the #1 cause of death for Hoosiers ages 1 through 44. Funding to support trauma system data collection and regional coordination, and enhancement to the state trauma registry, and grants to trauma centers and non-trauma centers to institute quality improvement programming based on the data and the outcome of that analysis. And then additional implementation of recommendations through the American College of Surgeons, who was recently here to investigate or evaluate, our trauma system. And then emergency medical services. This funding would go to the Department of Homeland Security to support a grant program to improve the readiness and sustainability of EMS across our state, including the possible purchase of EMS equipment, not necessarily ambulances, but cardiac monitors and other things in order to be able to raise the level from a basic life support to an advanced life support. Recruitment and retention initiatives are important in order to maintain this workforce, and then to reduce the financial burden of training for EMTs and paramedics by expanding the number of training programs and helping them with grants for that training. We've also asked for money for mobile health integration to perform pilot programs for interfacility transfer with our paramedics to a higher level of care. This will reduce non-emergent EMS runs and then assist our rural areas in that interfacility transfer that has become a significant issue. And lastly, 911 interoperability, which will eventually allow the closest, most appropriate EMS service to the Hoosier in need to respond to the emergency. Recently, the Indiana Department of Health received notice awards from the CDC, receiving $50 million for a public health infrastructure grant. This is over a 5-year period of time and will support a portion of our regional support teams for the local health departments and paid internships to attract more students to remain in public health in the state of Indiana, and also coordination of workforce placements across the state. In summary, the Governor's Public Health Commission felt strongly that every Hoosier, regardless of where they live in our state, should have access to those foundational or core public health services, and that local health departments will benefit from additional state support at the regional level, and that investing in public health today helps to ensure economic prosperity, and prosperity through a skilled and healthy workforce retention, emergency preparedness, and better health outcomes. And I'll turn it over to Shane Hatchett for the last couple of slides.
Thank you, Dr. Box. I will be going over the agency ask for us to be able to fulfill our current statutory responsibilities for the remainder of the 24-25 biennium, in addition to the Governor's Public Health Commission. As you can see here, our base budget started at $142 million, which is the same as our state fiscal year 23 projected expenses. This does include the additional appropriations given to us through Senate Rolled Act 2 this past summer. As Dr. Box mentioned, some of our change packages pertain to the Governor's Public Health Commission, and those were presented earlier. However, on the following slide, we outline a little bit more what our agency needs, specifically in addition to the Governor's Public Health Commission. For state fiscal year 24, where our agency ask is $262.1 million, and for state fiscal year 25, that rises to $370.2 million, which reflects our deliberate and thoughtful approach of phasing in the programming related to Governor's Public Health Commission and some different services that are being added. The bulk of our remaining change packages are listed here and represent our agency needs. Several of these changes pertain to increased staffing costs from shared services charges, as well as salary increases and replacing outdated equipment across our agency. Beginning in fiscal 25, we also have an ask of $2.2 million to address the lead case management needs after the current health issues and challenges grants funding expires, which has been supporting that program to that point. The HIV/AIDS funding request is not new. This was previously with the Division of Mental Health and Addiction, but has always been transferred over to the department through an MOU. So this is really just changing that appropriation and making it administratively easier. The CMS certification increase is for matching funds for surveyors to build out multidisciplinary teams for hospice surveyors, which is a requirement of new CMS regulations. Our Center for Deaf and Hard of Hearing Education ask helps us increase our staffing of audiologists to support families and replace outdated equipment used to screen children for hearing needs. Our cancer registry is to support the upgrade of a system that is being retired by our current vendor, which is used for collecting and reporting vital cancer data and submitting information to partners and our epidemiologists. And then finally, our maternal child health and infant category is representative of many of the initiatives that Dr. Box discussed earlier and includes a number of Senate Rolled Act 2 programs. So in sum total, our additional ask for 24 is $31.5 million, and for 25 is $34.2 million. This concludes our formal presentation, and I realize that we've covered a lot of ground at quick pace, so Dr. Box and I are happy to answer your questions.
Any questions? Representative Porter?
Thank you, Mr. Chairman. Dr. Box, excuse me, on slide 15, you had about the $50 million for health issues and challenge grants. Of those that you had in round one, and potentially two, how many of those went to minority organizations?
Well, that was a big part of the Health Issues and Challenges grant, was to determine how they would address the populations most affected or the most disparate populations that they would be addressing. So every one of them addressed that in some way.
Every
One of the grants that went out had to speak to addressing the disparities. And
So is there a way, excuse me, is there a way to get a list of those people who received those grants?
Yes.
Yeah, I like to see, because I have reservations about what the real outcomes were in regards to that, in regards to minorities really
Okay.
benefiting from this. And I will follow back up on that.
Okay, we will get back with you on that.
Okay, because I know we'll see you in about 6 weeks or less, so I'll ask the same question.
I'll have the answer before that.
Okay? Thank you, Mr. Chairman.
Any other questions? Senator Brown?
Chairman, quickly, a lot of the programs that you listed with respect to this actually would be occurring, the preventative health care would or should be occurring in the schools and at the local health departments. I don't want to necessarily put anyone on the spot, but it would be nice to have an overview of how many school systems and individual schools are actually doing scoliosis, eye, ear testing, receiving any kind of dental services within the school and the school system, as well as the local health departments. I understand that some counties are particularly small. They're not as robust, for example, as Allen County with a full health department, not necessarily fully funded locally, but a full health department, if you will. But they are looking at everything from restaurant inspections to lead paint, amelioration, environmental issues, the infectious disease. I know they're not all capable of doing that currently. And it would be nice to know as we move into looking at funding these proposals, which ones are not, where there is a gap right now. Does that make sense?
Specifically which counties, or, like, I did talk with Mindy up in Allen County. And
Yes.
talked to her about some of the things that she felt she could do better or do more completely should she have additional funding and money. So you're right, Allen County would be one of the best health departments that we have in the state. As far as
Right, they do
delivering
everything from
service.
septics to restaurant inspections. Not all of them do, they're statutorily required. I understand we do not necessarily fund all those mandates, but as well as with the schools. The schools, we expect them to do those eye screenings, hearing tests, et cetera. They're not all doing it, I understand that. I'm aware of it, I shouldn't say I understand why they're not doing it, but I don't think the communities are aware that they're not doing it. And so it would be helpful to know how many citizens and our students are being missed. And how that, because this proposal in part, I know there's a much broader public health push in your proposal, but this proposal in part would make sure that every student is being tested and that these from lead amelioration to restaurant inspections center are actually being done in every community. Okay, thank you.
Thank you.
Senator Mountain?
Thank you, Mr. Chair. Thank you, Dr. Box, and your team. On our previous meeting that we had, I brought up a question in regards to the opt-in, opt-out for the counties. And I brought up, we know that there are about 5 individual communities that have independent health departments from their counties. Just curious, just kind of remind me of what's going to be the method or the recommended method or approach on how to address those agencies that are standalone. As you know, Dr. Roland Walker, I spoke with him prior to knowing about this, and I just was curious. And he was very adamant about saying their ability to be nimble and flexible as a standalone to address the needs of the community during the pandemic. So I was just curious to get your thoughts again on that.
So the commission spent a lot of time discussing this. Oh, sorry. The commission spent a lot of time discussing this, and Overwhelmingly, we agreed that the three municipalities, so that would be Gary, East Chicago, and Fishers, would be grandfathered in, continue to exist, provided they wanted to continue to do that. In talking with these communities, the goal would be for us to work with them as a whole county, but to continue to have them exist in their community as a health department, but to make sure that everyone's getting covered, to make sure, I've heard like in Lake County that Hammond has issues because they closed their health department and there's no one to really service them or is comfortable with doing that. So how can we work with the county overall to make sure that there is access to everyone and it's on a bus line and other things that are needed to deliver those services? And then from a funding standpoint, we've been having some meetings with DLGF, and their recommendation strongly is that that funding would still go through a county level, but then be distributed as appropriate to the municipalities as they, work with a plan to work together.
And that's good. I just wanted to be informed prior to, I haven't seen any language or anything like that. And I was hoping that it wasn't going to be any encouragement of consolidation or things like that. I wanted to make sure we leave that up to the locals if that was something they wanted to do. Just a follow-up in terms of a thought to share out there. I'm not sure if you guys are aware about some of the issues as it relates from a fiscal perspective of like Methodist Hospital and what they're looking at. From a federal standpoint, they receive a lot of dish payment for moderate to low-income citizens, and there's some legislation now that could impact their federal funding, about $15 or $16 million. And that could be very catastrophic to lose or have a hospital not be able to provide those services. In addition to, in the region, Hammond has closed a hospital, not the city, but just there's a hospital. So there's a lot of healthcare shifting in terms of providers. And as we go into this session, I want us to make sure we keep that in the forefront. And I'm not as knowledgeable about the other parts of the state, but in Northwest Indiana, there's a lot of volatility at this point.
Yeah, I have had discussions with Hospital Association, Dr. Rosiniak. We understand that is an issue. Thank you for bringing it up.
Anyone else? Senator Gadora.
Thank you, Mr. Chair. I'll be brief. Commissioner, pleasure seeing you again, and thank you for the time you took for us to meet and discuss this, the health report. I did introduce Senator Kenley an amendment during the special session to fully fund this report. I'll continue to advocate for this. Question on the graphs page, well, sorry, there's no page number on this, but the one with the IDOH Investment Nurse Family Partnership expansion, there are annual funded capacity, and I'm looking at the state dollars. Are these the unique numbers of individuals who have been served by the NFP?
That's the number of numbers that they will be able to serve based on the funding they're receiving and in the counties that they'll be.
So it's an estimation.
Yes, they know about how many people based on the number of nurses they have that they can provide care to.
And will we have any kind of report on the outcomes of those services so that we know what type of service was offered and the outcome of that service?
Yeah, so Nurse Family Partnerships does a very good report on a regular basis that we could get the copy of that to you.
Great.
But more importantly, at the state level, as we're bringing all these home visiting programs together, we are now moving from just at the state level, who were we able to reach and who actually accepted a referral to a home visiting program, to the next stage, which is getting that data and information back from the home visiting programs. And we're starting with Healthy Families and Nurse Family Partnerships because we have direct access to their data so that we will know not only did they engage and sign up, but how many visits did they have? And then the next step is, of course, looking at what was the outcome of their birth, right? When did they deliver? What were the APGARs? What was the baby's weight, et cetera?
Excellent. My final question is as it relates to the report and workforce development for the healthcare professionals. What is it? Can you speak a little bit about your plans for developing the healthcare professional or helping healthcare professionals, retaining them, attracting them, especially in those counties that you highlighted on the map where we have shortages? Because in my discussion with you, if you recall, I met with CHE, the Commission on Higher Ed. We looked at a few scholarship programs that we currently fund, and the outcomes of those scholarship programs are not where we hope for it to be. For example, the Primary Care Scholarship Fund, we have a number of people who receive funding for their medical school year 1, 2, 3. They get matched to year 4, they leave the state, so we lose our investment. So I'm suggesting to them to backload those dollars instead of front-loading them and have post-residency requirements to say, for every year that you live and work in Indiana, we will give you the same amount of money in the form of loan forgiveness instead of front-loading it, because we're losing people who are paying to stay in Indiana and then they leave the state. Any thoughts on the workforce retention and attraction strategy and the scholarship programs?
So as you probably already aware, we get a match from HRSA for retention, especially in the need areas in the state of Indiana. And that includes not just these particular counties, but it also includes mental health. It includes things like obstetrical care and other things. So we work with that at the Indiana Department of Health, and we're working very closely with Bowen School of Workforce and Public Health Policy. And as we are continuing to do this, and we are bringing together the clinical workforce data with the public health workforce data, we will actually developing a workforce plan to make sure that we're not just addressing the gaps that exist now, but also as we go forward, can we start to project what those gaps are going to be in the future? So we're not always kind of playing catch up on that. So as we look at that, we just had a meeting today because North Carolina has a program where they actually regionally put people in to actually kind of attract different providers into those areas and kind of introduce them to the healthcare systems and the healthcare people and the public health people in those areas. So we have a meeting coming up with them to have further discussions on that also. So there's a lot of work being done around that, but more work to come.
Thank you. I appreciate you. And I think in my legislation, I'll suggest something that we discussed, which is state dollars matching the HRSA dollars, because that we stretch state dollars to make more funding available to attract healthcare professionals. So
Every year we beg, borrow, and steal to come up with whatever match we can to the maximum they'll let us so that we can
Absolutely.
fund as much as
I
possible.
appreciate it. Thank you, Mr. Chair.
Anyone else? Well, I just want to thank you and Senator Kinley for taking the time to meet with most of us individually to go over the details of this. There's a lot of moving parts in it. I think the fine details that you went over made it much easier for us to follow. At least I'll
Good.
speak on my behalf. And I also want to commend you on your extra documentation, especially this sheet right here, where you actually put the Governor's Health Commission and your change packages together, so it's easy math. So
I have a
thank you
great
for that.
team that thinks ahead, so thank you for that. Thank you for your time today.
Thank you. Next, we have Department of Correction, Christina Regal. Well, welcome. I know you're new on the job. I know Rob retired, and I was just telling Krista, I used to get those DOC reports in my personal email from Rob, and then all of a sudden I saw this new name show up in my inbox. So, so welcome.
Thank you. Appreciate it. Good afternoon. I am Commissioner Christina Regal with the Indiana Department of Correction. As Senator Mishler mentioned, newbie. I think it was the end of October that it became official. Prior to that, I served as the Deputy Commissioner of Administration and Chief Financial Officer for the agency. I've been around 12 years. I'm going to go ahead and turn it over to Randy Custer to get us started.
Thank you, Commissioner. Chair Mishra, member of the committee, my name is Randy Custer. I'm Chief of Staff of the Indiana Department of Correction. First of all, thank you for the opportunity to present to you today. Before I get deep into the deck here, I wanted to point out the actual cover of our presentation. There's a quote from the Indiana Constitution, Article 1, Section 18, and it says that Indiana's penal code shall be founded on principles of reformation and not of vindictive justice. And that's something that we hold dear. In fact, we embed that, we intertwine that with our mission and our vision. Typically, I would be here and I would just read our mission and vision because it hasn't changed in many, many years, but that's not true now. Our mission has changed this past year with 2 words, and those 2 words are incarcerated individuals. Before that, last year, and since we were really departmentalized, we used the word offender. And that kind of makes sense when someone is recently sentenced. They've been accused of being a violator of Indiana's criminal law. They've been found guilty. They no longer are presumed innocent, and they are an offender of criminal law when they get to us. But after they get to us, as they start progressing down a case management plan, as they start getting some wins under their belt, maybe they learn some job skills, maybe they deal with some addiction issues or mental health issues, maybe they improve their educational abilities. Using the word offender and branding them with that word tends to have a very negative impact, you can imagine. And using it all the way till they're getting ready to release just does not make sense. It's just not conducive to successful transition. So what we've done and what we're in the process of doing, this is not easy. We can't just, flip a switch and have everybody start using this vernacular, but we're starting to. We're starting to change policy. We're starting to call people out on it. And I'm going to apologize in advance. If I use the word offender, I probably will, because old dog. But we're really trying hard not to do that, and we're trying to change the culture. Another cultural change that we have that's not insignificant is we created a motto for the agency. Our motto is changing lives from the inside out. And we're really trying to change the culture of our agency to focus on the rehabilitative and reformative aspects of things. Now, this next slide is probably what you would be accustomed to seeing on behalf of the Department of Correction. These are the prisons in Indiana. We run the prison system, among other things. And you can see we operate from the far north to the far south, from Michigan City to Tell City. And it's kind of hard to read on the PowerPoint, but hopefully you can in your packet. There are numbers and letters. The letters on these location dots, IN, that signifies where we have intake units for our adults. Adult males are received at the Reception Diagnostic Center in Plainfield, Hendricks County. Adult females go to Park County, the Rockville Correctional Facility, and that's where they're received. And they go through a classification process. We look at a variety of factors, and I mean a list as long as my arm, not just the obvious like criminal history, instant offense, institutional conduct history, history of addiction, gang affiliation. There's all kinds of things that get taken into consideration. We have a certified approach to classification. And what we do is we classify them by security level, 1, 2, or 3. And you could see the numbers on those dots. Those security levels, 1 represents minimum, 2 medium, and 3 maximum. And one of the messages we're hoping to deliver today is that there is a vast difference between a minimum facility and a maximum facility. If you walk into a minimum security facility, you're going to see a big room. The housing units are going to be dormitory. You're going to see racks of bunks of beds in large groups. And that's fine for minimum. These guys and ladies, they go out during the day. They're in treatment and programming. They're at work sites. They're in day reporting or day rooms. And then they come back and sleep at night. And they're fairly easy to manage and supervise. Maximum security guys, that's a lot harder. We put 100 of them in a room. Bad things will happen unless we can compartmentalize them, unless we can control movement, unless we can control how we supervise them, and that requires celled housing units. Another aspect of the department that sometimes gets overlooked is we also receive juveniles. We receive those who by juvenile courts are adjudicated delinquent and sentenced to the Department of Correction. Usually these are people who are under the age of 18 that aren't treated as an adult. What you should take away from this is what you don't see. What you don't see is 8 dots, which 20 years ago we had 8 juvenile facilities. We had about 2,000, more than 2,000 juveniles in the Department of Correction. Today we have about 330 and 3 facilities. The gold dot is our female students at LaPorte County in LaPorte Correctional Facility. Another aspect of the agency that sometimes gets overlooked is the post-incarceration supervision, what happens when people get out of prison. About 98% of the people sentenced to prison will get out. And they take different tracks when they get out. Some, usually these are the ones with mitigated sentences of fairly low felony, they might be supervised by the courts in county probation. Though some will go through a statutory procedure called CTP, Community Transition Programming. This is where judges might pull someone out a little earlier than their expiration date and put them through my words is a step-down process. Each county does it a little differently, but they might go from prison, maybe spend a little bit of time in jail, then community corrections, then probation. And that's about 11% of those released from prison. Some are discharged. A handful serve every day of their sentence in prison, and they get discharged. They get discharged when they walk out. They have no post-incarceration supervision. But about 45%, a little over 45%, they get released to parole. And these are the people who aren't mitigated. In fact, a lot of them have serious felonies. A lot of them have aggravated sentences. And they go to one of our 10 parole district offices across the state. And we've done a lot to change kind of the attitude. If you're a parole officer in Indiana, you really wear two hats. One hat you'd probably recognize. This is the one that is, I call it kind of the cop. They make sure that these guys abide by their conditions, their stipulations of parole, and each one comes out with a list. Some of them are very obvious. Don't commit any more crime. Don't use illicit drugs and so forth. Some are very specific, like sex offenders and others might have a specific set of conditions. And so one of the hats is to make sure they abide by those do's and don'ts of parole. The other hat, and this is one we've been emphasizing a lot in recent years, and that is they really get to the mission of success. The whole idea of the Department of Correction is for people to transition from prison, go back home, assimilate back into the community as productive citizens, get out of the criminal justice system, and don't come back. And that takes help. And so one of the hats a parole agent will wear will be just that. They will work with our higher division, help them get jobs, help them get meaningful employment. They will help ensure that they work with our medical transition team to help connect them to the medical services they get. They might check and make sure they get the mental health treatment they need, addiction recovery treatment, they'll check on that. But they'll also just be there to listen to their stories and to listen, what challenges are you facing? Sometimes they say, I can help you with that. I can help you get transportation. I can hook you up to the community that can help solve that problem. Sometimes they say, you know, life is tough. You're going to have to deal with that because not everybody can have everything they need all the time. Sometimes they have to work for it. So it's a delicate balance, but one that I think the commissioner is going to talk about some of the KPIs, some of our performance measures related to this whole effort, and I think you'll be pleased. We can't do it in a vacuum. The Department of Correction can't operate alone. We need our community partners, and this is community corrections. These are county agencies. As you can see, all but the white participate in community corrections, a vast majority of the state. They participate. The gold you see here, those are regional departments, local departments. That's where a county will partner with another county or more than one county. Oftentimes, that's when they just don't have a loan. It would be inefficient. They just don't have a lot of people, so sometimes they partner to get more efficiencies. These are grant funded through the Department of Correction with guidance from the JRAC Commission. We fund them with community correction grant dollars. The dots you see, years ago, there was a lot of accusation that Indiana doesn't have work release centers, that they'd all been closed. And frankly, for a while, in the late 80s, early 90s, they had been. But work release is alive and well. It's just not being operated much out of the Department of Correction. We have a couple of facilities that operate work release centers, but we fund work release through the counties. The counties have local work release and residential centers. That's the blue dots there. And the number you see is the capacity of those programs. But as you can see, it's alive and well in Indiana. This is the community correction composition. If you look, the gold and the gray are pretrial and misdemeanants. We also fund misdemeanants, at least partially, with a misdemeanant fund. But I'd really like you to focus on the dark blue band in the middle of each bar. Those are people convicted of felonies. And those are the people, but for community corrections, they would have to find another place, someone else to supervise them. They could bring them to jail, but a lot of those are being diverted from prison. They're people we're not getting because community correction operates. And frankly, community correction does a really good job providing local options for sentencing judges and prosecutors, but also helping us manage Indiana's felony population. And with that, I will return it back to the Commissioner for the rest of our presentation.
Thanks, Randy. I want to start off talking about some of the successes that we've experienced in the Department of Correction. These are some things that we're really proud of. We've focused on making these successes happen. Randy mentioned kind of a change in thought with parole. This has been going on for quite a few years, but probably 3 or 4 years ago, we started bringing in individuals who had been released from the Department of Correction and just talking to them, asking them, what could we have done better while you were with us to help prepare you? What could we have done better while you're on parole? And what was just your life experience once you left? One of the things that we heard was not surprising. We know that having gainful employment is essential to not recidivating. It has a major impact on the recidivism rate, not just in Indiana, but across the country. We put that to work. We challenged our parole officers. Back in 2018, the average wage for a parolee was $12.71. We started working with the HIRE program that Randy mentioned and really just putting a focus on helping everyone understand how important it was. Our last report was $16.78 an hour for individuals on parole. It's a 32% increase for us. And as of this week, we're actually at an average of $17.17 for individuals on parole. 83% of our current parolees are employed. That's really cool, and I'm very proud of that, but I think I'm most proud of the next stat. It's not maybe as big of a statistic, but what we heard was that from the time they were released till the time they got a job, and then were able to get, a car and housing and things, was probably the most difficult thing for them. So we kind of flipped the script, and we started focusing on pre-release employment. So we have individuals within the agency who are dedicated to helping incarcerated individuals have an actual job offer in hand with a start date before they leave. When we first started this, I think the first focus, I think we had 6 months, and we were really excited that we had 11, and we were celebrating that. Last year, we had 750, and that's going to continue to grow. Another area of focus is, and this is a KPI that we measure, is the completion rate of our substance abuse program. We changed the programming model inside our facilities to match the treatment model that's provided to those on the outside. We also started providing those services at intake from the moment they walked through the door instead of waiting until they were getting ready to release. 75%, when you look at it, might make you kind of wonder, 75%, is that really something to be proud of? The latest study on substance abuse treatment on the outside shows a 42% completion rate out in the community. So it's absolutely something to be proud of and something we're going to continue to work to drive up. Our recidivism rate in 2021 was 33.8%. That's the lowest on record since we started measuring. In Indiana, we measure recidivism as a return to incarceration within 3 years of release from a state correctional institution. And then again, the last bullet point with the over 80% of qualified parolees attain employment within 5 months of release. We're looking to shorten that down that time, and we're successful in that, but right now our measurement is that first 5 months. I wish I could only talk about successes, but we do have several challenges. Staffing has always been a struggle. It's a struggle, again, across the country. It's tough to have individuals who want to work in a correctional facility. But even more so, we're having some serious staff vacancies. We are doing some things to address that. During COVID, we actually had the National Guard in our facilities helping run some both on the medical side and in operations. We've also are fortunate enough right now to be able to do some compression of our population. Our population is down right now in some of our facilities, and we've been able to close some housing units which will relieve some posts, and we can use individuals who would have been there, or the vacancy doesn't impact us as badly. Another major challenge for us is just the overall housing unit type. We are 66% dorm beds and 34% celled space in the Department of Correction. Randy mentioned that with certain individual, dorms are harder to manage, and they're actually impossible to manage with maximum security offenders, incarcerated individuals. It was me first instead of you. Yeah. And just overall, our prison population is changing. So I'm going to go into that a little bit on this next slide. That, again, the overall makeup of our population is very different than it used to look. So this graph that you see on the top right-hand side, this shows the percentage of adult population that's classified as maximum security or close supervision, those that we would need that celled space for. In 2012, just 27.4% of our population fell into that category. In 2022, right now, we're at 37.8% of our population. There are factors that go into this. We mentioned the classification that we do. We look at the nature of the offense, the conduct history, behavior while in our facilities. Some things that we've done to really take a look at this and make sure that these are accurate numbers, that we have people classified appropriately. We have reviewed our classification designation instrument. We actually went through a validation study to make sure that we were, one, doing it the right way, that any overrides that occurred to kind of what was recommended from that instrument, that we had the right set of eyes on that. And here in the next 6 months, we'll finish up training and we'll be rolling out a new classification designation instrument. Because of this graph that you see, our maximum security facilities have been over 90% capacity since 2019. The second graph that you see is our percentage of adult population needing treatment for serious mental health. 80% of individuals that come through our doors require mental health or substance abuse treatment, but this graph is specifically for those with serious mental health needs. In 2015, we were at 21.9%, and today we're at 33.5%. The difference in these types, so I mentioned the 80% versus this, is a special area. They do treatment is better in a celled environment. It's safer for the individual with those serious mental health needs. So because of the challenges with staffing, with the changing population needs, we've been very deliberative in decision-making for design of the new Westville Correctional Facility. So I want to start out by thanking those of you who toured the Westville Correctional Facility. I think it was probably eye-opening for you. I will say it meant a lot to me to be able to show you kind of what we do on a daily basis. And I'm hesitant to say it, but that day was a little embarrassing for me. I'm proud of our staff. I'm proud of what we do. I'm not proud of that specific facility. I'll get into a little bit more on why for those of you that weren't here. But last biennium, we were appropriated $400 million for the rebuild. We're here in this biennium asking for an additional $800 million for a total of $1.2 billion. This is solely due to the cost of inflation, the cost of materials, the cost of labor. We are not building the Taj Mahal of prisons. We didn't change the design from our original request. We don't have fancy things in here. Unfortunately, we're seeing some of the same things that the other capital projects are seeing. We also, throughout this process, we've traveled to Pennsylvania, Idaho, Utah. They're seeing kind of the same percentage increase in the projects that they're running. For those of you who don't know, Westville Correctional Facility was first opened as a mental health hospital. It was a state-run facility in 1951, and about 30 years later, the campus was converted to a medium-security correctional complex. We have around 3,400 beds. We do have a 220-bed maximum control unit. These buildings are spread over 120 acres. This is a massive, massive complex that is not conducive to being able to run a facility. Westville Correctional Facility is at the end of its life. Regardless of the change in our population that I talked about and our needs, we can't continue to operate this facility. We experience 3 to 4 catastrophic events a year at this facility. Just early October, we lost power to the entire campus. We had to drive to find parts that would work in our outdated systems to be able to bring that power back up. And you can imagine in a prison, power operates a lot of things. When the power goes out, it is a huge safety and security risk to our staff, to the incarcerated individuals, and quite frankly, to the public. To completely replace the electrical system failures throughout the facility, or the electrical system throughout the facility, would cost us about $50 to $60 million. The facility also is heated by outdated boilers for a replacement cost of $150 million. December 1st of this year, when it was 17 degrees out in northern Indiana, our final boiler failed. Our only resource was to give additional blankets to the incarcerated individuals to try and keep them warm on the unit while we tried to do the repairs. The first 3 companies that we contacted said that they could be there in a few days. And we said that's not going to work. So we were able to get the boilers up and going, heat restored. I think it was around 6 to 8 hours, but that's tough. The entire sewage system needs replaced at a cost of around $50 million. There's no air conditioning, and I know that air conditioning may sound like a luxury in a prison, but not being able to regulate temperature, aside from making it a terrible working condition for staff, is really bad for medications, so especially those medications for mental illness. If we can't regulate temperature, we can't control how the body metabolizes the medication, and it really causes some issues on the medical side. Anything that we do, we have to worry about asbestos throughout the entire facility. And there's some major general security concerns due to the condition of the facility, and quite honestly, not just to the condition of the facility, but just because it's not built as a correctional facility. It was built as a mental health hospital. My very first day on the job as commissioner, I received a call that we had a possible escape from Westville Correctional Facility. What happened was that an individual was able to pull back drywall in a housing unit and get into the tunnels of the facility. Fortunately, we were able to track down, and he was still in the facility. It ended well. We were able to get him out, but that was not a fun first day. And unfortunately, that's not the first time something like that has happened at that facility. Just a few years ago, there was an incarcerated individual who was able to access the HVAC system, which would normally never happen in a prison, and he was up there for 3 days before we were able to locate him. The overall layout, I told you it's spread over 120 acres. We run 4 kitchens, all of which are at the end of life. There are 6 different locations for MedPass. So you can imagine the staffing that's needed to be able to control movement and work in those multiple locations. The new facility requires fewer staffing due to these efficiencies. The new Westville design, again, is going to help us with some of those challenges that we're facing. The pie charts that you see here represent the change in the levels of the incarcerated individuals at our maximum security facilities. You'll see in 2012, little less than half of the population within our maximum security facilities were actually classified as maximum security in 2022. More than half and nearly all are classified at high, medium, or maximum security. We also have the increase in the special needs population, which requires space and resources for us to be able to provide programming. The new Westville design allows for programming on unit, which helps with staffing. It helps with the incarcerated individual and their ability to be able to attend programming. And it also allows programming to continue in case of, I don't know, something like COVID or lockdown, things like that. We're still able to continue day-to-day operations in the facility and be able to provide that important programming, not just on the mental health side, but on the reentry and education side as well. We have 3 facilities right now that have a total of 65 general population beds available in our maximum security unit. This new Westville design takes an entirely dorm setup and moves it to almost an entirely celled space. There is still dorm space. Dorm space is important for step-down units, for certain programming, and we always want to have individuals in the least restrictive environment possible. So it does not eliminate dorm, but does help fix the issue with requiring additional celled space. Aside from our capital project, we do have some operating appropriations, some general fund change packages. It's split into 3 groups here on the screen. The first being rate increases. These are increases that you've seen probably from almost every presentation, and Director Jackson presented on at the beginning. Won't go too much into those, won't go into those at all actually, but if you do have any specific questions, happy to answer those. The next group is our contractual CPI increases. The first change package is for our correctional services. Our correctional services fund is where we pay for our comprehensive medical. We have pay for our food services and our education, both adult basic education and our vocation. Last biennium, we were actually in the middle of an RFP for our medical contract, and we did our best guess on where that might come in. Once that contract was executed, we were short. So the change package that you see is kind of a combination. It's to shore us up for the medical contract, and then for the annual CPI increases or cost of living increases that are built into all 3 of those contracts. The next one is third-party facility management. We have 2 facilities in the state of Indiana that are operated by the GEO Group of our Newcastle Correctional Facility in Newcastle, Indiana, Heritage Trails Correctional Facility in Plainfield, Indiana. The change packages you see here are for those CPI cost of living increases that are built into those long-term contracts. And the third bucket you see is for utility increases. We are continually doing projects to create utility efficiencies, but there have been several utility rate increases that have been approved by IURC over the last few years, and we're actually expecting an additional 7% increase. The change package that you see here is just to make us whole from the increases from 2020 to 2022. We are not asking for that anticipated increase. We'll hold off until we know that what that actual calculated impact is, and in our next biennium could possibly be asking for utility increases for that. With that, I'm going to breathe and go ahead and ask for any questions.
So go back to your new facility here for a minute. So, you know, we've talked about that for a couple of years. You've been on some meetings, I think, with Rob. And, you know, 1.2 billion is almost cost prohibitive. I mean, I'll just be honest. So one thing that I had been in some discussions with some folks with is the idea of doing these pods. So where you can, you know, expand as you go, but maybe get started with a less amount of money. So what's the thought of doing something like that?
So I think I have a couple of thoughts on that. Buying power in general, I think the longer we wait and the longer we draw it out, I do worry about whether costs will continue to increase throughout time. I think that there's value in purchasing large quantities, having labor. For us to be able to, it impacts facility operations if we've got to kind of corner things off, shut things down. And I mean, I think that, we're going to be open to discussing it. I don't think that it's probably the most efficient or beneficial way to do it.
Well, I didn't say it was going to be beneficial. I'm just saying, if we don't have 1.2 billion to do it, I think you need to think of some other options.
Sure. Yeah, and I'll tell you, we've considered several other options too. I served as the CFO for 12 years, so coming and asking for 1.2 billion isn't the most pleasant thing for me to do from that standpoint. We have a facility in Pendleton, Correctional Industrial Facility. It is celled space. However, the cells don't have sinks or toilets, so it isn't conducive to changing that over to a maximum security facility. We've looked at Pendleton Juvenile Facility and converting that celled space to maximum security. That's another 200 million. We could probably still only make that medium security because the shell of the facility itself isn't adult maximum security built. We could add housing units at Wabash Valley Correctional Facility. I haven't done recent cost comparisons. This is something I was looking back in 2019 when we were originally looking at building Westville. It'd give us another 768 beds. 2019 dollars was $70 million, and then an additional $5 million a year in operating costs. Again, that was 2019 dollars. So we'd have to take a look at what that is in 2022 dollars.
And I'm not disagreeing that the facility, I mean, it shouldn't even be a prison. I mean, it's not conducive for a prison. I mean, I don't think anybody's going to disagree with that. It's just the cost to build a new facility like that.
Yeah.
So I would just suggest looking at some other options if we can't do the 1.2 billion. Senator Melton.
Thank you, Mr. Chairman. Thank you for your presentation. Going to your proposed appropriations on the third-party facility management, you mentioned the cost of living increase, but when I look at the number from fiscal year 24 to 25, that's a substantial jump. So can you kind of explain that a little bit?
Sure, yeah, so it's on these contracts, it's capped at a 2%, but it is base building. So the first year is the 2% you see for 2024, then 25 is that 1.7 plus an additional 2% on the entire contract. So that's why you see that difference.
And what services are they providing specifically?
They completely operate those facilities, so custody, case management, everything that we do in our facilities, GEO does in those two facilities.
So the workers that work for GEO, not the state?
Correct.
Okay. Is there a cost savings for the state to do that?
There is. So we evaluate almost on an annual basis of where that kind of cut-even point is, and we make sure that it is still cost-effective to continue contracting that instead of taking that contract back over.
All right, thank you.
Yep.
Senator Brown.
Thank you. Along that line, so you look at the cost-effective nature, but congratulations on your recidivism rate, et cetera, that you're talking about and getting jobs before they, does the third-party GEO, do they have the same metrics they need to meet?
They do. So they follow all of our same policies. When we talk about recidivism rate, those are still our incarcerated individuals, even though GEO is running it. So all of our data, all of our statistics includes those individuals.
So they're doing in-house, so to speak, substance abuse programs and job training and all
Yep,
this? Okay.
correct.
And then in your stats, when you're talking about the recidivism, you're talking about those on parole, but not everyone released is on parole, right?
Correct.
So what is that comparison in terms of numbers? How many percentage-wise being released on parole and how many are free and clear?
We're about 45% are released to parole.
It's about 4,000 a year.
Okay, so 4,000 a year, so about 5,000 plus are released. And so do you track that recidivism rate? And do they also have jobs waiting for them, et cetera? Because you didn't give me those numbers.
Sure, yeah, so the recidivism rate counts regardless of how they were released, any of the multiple ways they were released. So it's if they left our facility and came back within 3 years, they're recidivists.
Okay, so it looked like the numbers you gave, talked about those on parole, but these were actually numbers for all of your,
That is for, yes.
oh, I
Yes,
see. I got
apologize,
you.
yep.
All right, thank you.
Rep. Porter?
Thank you, Mr. Chairman. Thank you, Commissioner. And, yeah, I remember my few hours there, we got awfully wet in the rain. And during our conversation, we had talked about the mental health perspective. And I had asked I asked one of your team members about what was the success rate of the wraparound services that you guys were talking about and how they taught it, that you'd done research, not you, but your team had done research. And I asked for the demographics, what was the success rate? And you said you would get that to us. I'm still waiting.
Yeah, so, yeah, I followed up with our legislative director last week and asked if she was able to connect you, and I'll double check with her again to make sure she's reaching out to the right person in your office.
Yeah, that was about 6 weeks ago or
Yep.
something, so.
Yeah. Yeah,
Thank
she, I had asked her right away, and we'll follow up on that.
She forgot, okay. Thank you. Speed up.
Fedor?
Thank you, Mr. Chair. I just have two quick questions. Are you asking for $1.2 billion in cash, or are you financing it over 25, 30, 40 years?
So the 400 million is already appropriated
Correct.
cash, so the 800 million, we are open to looking at a mix. I don't think we're looking at financing the entire 800 million. I think that a mix of that might be appropriate. We could have conversations kind of on what that payback would look like, how we would be able to make the payments on any bonding that we do.
When I was a city controller, we built the Indianapolis Community Justice Center, and it was a $1.2 billion transaction, including finance cost. It was financed over 25 years, and there are all kinds of solutions, financial solutions that may be considered as part of that. We looked at the nuances of transitioning the operations, and I was surprised when when Senator Melton asked the question on the third-party facility. For 30 years, Indianapolis had a third-party facility management. I think I have a different philosophy on this issue. If a for-profit entity can make profit and run these prisons or jails, I don't see why we as a state can run them without having that profit. And I think inherently there's a contradiction in mission. A for-profit entity would not be successful if these jails are empty or these prisons. For them to be profitable and to exist, these prisons have to continue to be filled with people. So from our constituents' perspective, they see it as a bad deal. They see it as work, and I appreciate the change in mission from offender to incarcerated, but it goes against that mission change that we're paying folks to make a profit. So all my comment is that I think there are financial, I trust your judgment. I just urge you to think through different finance models. I know interest rates are high now, higher than what they used to be before, but there could be several options of how to structure a financial deal for the next 25, 30, 40 years. Maybe you can use the $400 million that you currently have, instead of spending it up front, to finance for a certain period of time and be able to refinance the bonds that you issue in 10 years from today, maybe when interest rate is much lower. So there will be a maturity date by which you can refund those bonds and issue new ones. So I just urge you to use the $400 million to stretch them over the next 10, 15 years with the ability to continue financing the rest of the project using maybe future state appropriations. I trust that your team can look into all of these things, but I know that we can do with the $1.2 billion. I think there could be some solutions. Thank you, Mr. Chair.
Actually, Senator Fedor, that's our decision to make whether we're going to bond it or cash pay it.
I understand. I see this as a collaborative, since they suggested when an agency asked for $1.2 billion and we come up with this legislative solutions, I think it's helpful, that partnership with the agency, to look at what operations and how does that impact them. But you're correct, it is us. So I will be bugging you between now and session to fund all kinds of things.
Don't you have a vacation? Anybody else? All right, thank you.
Okay, thank you.
Welcome Superintendent Carter.
Hello, good afternoon. 11,000 year to date. Jeez. Okay, thank you.
Floor is yours.
I'll be as brief as I can be, sir. I'll be as brief as I can be. You've had a long day. I'll just jump right into some of the things that we've had some success with over the course of these last 2 years. And frankly, there have been a lot of them because of the ability that you have given us from a fiscal perspective, and then the relationship that we have with the Governor's Budget Office. We still face enormous challenges, and I anticipate those challenges continuing. I never thought in 2012, when this run began for me, that we'd be facing the things that we're facing today, but the reality is that we are, and we should be expected to continue to evolve and acknowledge these societal shifts, and we'll continue to do that. I see the ISP, when we identify a problem, what does that problem look like in 5 years, and then how are we going to work it backwards and start to solve it today? And one of the things that we've done from an operational perspective is to specialize and do what other agencies in Indiana cannot do. There's a lot of duplication, as many of you in this room have had conversations with me and me with you about that very issue. So we continue to specialize as much as we can to support local communities with assets, resources, knowledge, experience, and education that sometimes other agencies cannot. It just simply sets us apart and makes us different than them. It's certainly not any better. The statewide law enforcement community is very important to me. And again, the challenges that we're facing now are immense, but we're going to continue to stay focused on the end result, and that is provide the best service that we could possibly provide. As many of you know, I was not a supporter of the body camera program. I was completely wrong for a number of years. And it was one of the best things that we've done as an agency in a long time. I could talk about the body camera and in-car program ad nauseum, but when the governor directed me to do that, it's been quite an experience since. We've got 1.4 million pieces of evidence now. We kicked that program off in late June of 2021. So we're now about 18 months in, and the benefit and the value of that investment is beyond pale. Again, I could talk a lot about that, but each frontline trooper, about almost 800, have a body camera, and many of that 800 have in-car cameras, both front-facing and rear-facing. And it's amazing what we see, it's amazing what they experience, and it's amazing what happens around Indiana on any given day. We periodically will audit those, so we don't just let them sit. First-line supervisors are required to audit the people that work within their squad, and that happens fairly regularly. We do that for a number of reasons. First and foremost, it's a very objective overview and review of an individual. But secondly, it gives us the ability, when the complaint does come in, to immediately address it and go right into the system and find out exactly what occurred during that particular interaction in a home, in a business, roadside, wherever it might be. The technology that we've been afforded also allows us to dial in to an individual incident in real time. So with proper permissions, I can dial into a body camera from my office and see what's happening in Posey County, Indiana. So again, just hugely, hugely, hugely beneficial, and I am so glad that we've worked through that process. Mickey James, our CFO, sitting next to me, none of that would have happened without her. And I am certainly not going to take even a small amount of credit for this. This happened because of a very complicated procurement process that was streamlined with the relationship with the budget office, Department of Administration, and Mickey James. From an operational perspective, we built policies around everything we do, as you would expect for us to do. And again, I'm very proud of where we found ourselves today. One of the things that keeps me awake at night, particularly with the long-term issues associated with the ISP, is recruitment. We're in big trouble. I started on the department in 1984, and we had the same number of troopers today we had in 1984, now almost 40 years ago, for a number of reasons. But that caused us, over the last couple of years, to take a step back and really review how we're recruiting and why. And I wish there was a magic answer. I wish I could come to you and tell you that I'm pleased with where we are right now, but I'm not. And it's affecting service in many of the geographical areas that you all represent, and I'm very, very concerned about that. Generally, we have between 40 and 60 people graduate from one of our recruit academies. Tomorrow, we'll graduate 10 people. We'll lose 140. So I'm very concerned about that. And again, it's not optional whether or not we're out there in the middle of the night. We have to be. But we're beyond our ability to have somebody in every county 24 hours a day. We just simply can't do it. We just simply can't. So I've made it very clear to the district's field command that don't anticipate any relief with their staffing until sometime in 2024. And I just hate that. I say 2024 because our next academy will begin in July with a new recruitment strategy. And I hope that we can fill an academy in July. They won't graduate until December. They'll spend 3 months in the field before they're out on solo patrol. So it'll be sometime in the spring of 24 before we see any real relief. And I'm hugely concerned about it. We've done several things. We created IndianaTrooper.com, which is a direct link for any applicant or any citizen of our state or anybody really around the world that can log right into IndianaTrooper.com, and it'll give them all that they need to know about the application process and what to expect. Identified recruit liaisons. These recruit liaisons are connecting with every applicant personally, or connecting with every applicant, sharing phone numbers, contact information, and then the liaison will help that individual through the process. It's something we've never done before, at least not to this level, and I couldn't be more proud of those guys and gals that have thought about this and have really done an extraordinary amount of work to get this up and running. Our minority recruiting initiatives still aren't working. That responsibility lies with me. And I'm trying everything within our power to adjust what that outcome will be. And I think it's important. Currently, 12% of our workforce are minority employees. And of that 12%, about 30% of them are in the rank of corporal or above. I need to do better. I need to do better. And I can assure you that we're continuing to talk about any possible option that we might have to better recruit our minority population. Our training is certainly at the front of people's minds right now, as it should be. We must change the way in which we train, and we're starting to do that. As an agency, in both with the State Police Academy and also with the Indiana Law Enforcement Academy that you'll hear from in a few minutes. Just very quickly, people like me and my generation learned by lesson plans, and then PowerPoints, and then take a test, take a quiz, take another, receive another PowerPoint or lesson plan, take a test, or take a quiz, then take a test, check the box, and move on. We know that people don't learn that way anymore today. They learn through actually experiencing what it is they're expected to learn. So that comes through hands-on training, and with the impetus on de-escalation, but actual in-time, hands-on training. We've done that as a state police agency. Now this is our second year. We call it BCOP, which is the basic concepts of policing. For the first 16 weeks, they'll go through the academic piece of the academy. Then the 8 weeks after that, or 9 weeks after that, it's all hands-on all scenario-based training in a multitude of environments. So it's important that you hear me say that, because I think that should be your expectation of us, and specifically of me, and I should be held accountable to that standard. And we're working towards it as aggressively as we possibly can, but not recklessly. Aggressively, but not recklessly. Our laboratory system moving through this is an overwhelming success because of you. The ability for us to build state-of-the-art laboratory systems in Indiana, in Lowell, Evansville, and Fort Wayne is something we'll never see again in any of our lifetimes. We invested almost 30 million, 20, in Fort Wayne, we've invested 25-ish $25 million on a post and lab facility that's now up and running. Went from 7,000 square feet to 23,000 square feet, and it's showing huge success, huge success. The scientists within the ISP and the laboratory division has always been the shining star of our agency, because they represent every single police agency in Indiana, sometimes even here in Indianapolis. Indianapolis is the only other entity or municipality that has a crime lab, but we have a great working relationship with them, and we must share resources rather than continuing to try and build our own. If we can share, and we must. So we're trying to do this as much as we can. We're in the Fort Wayne Post, up in Senator Brown's area, Senator Mishler's area. Now we're moving over towards the Lowell Post, which is well underway. Again, with the Department of Administration, specifically Brian Renner and Zach and his staff, we're well underway. That is boxed in now. We anticipate moving into that facility sometime in likely May, which really means August. But I think sometime by the end of summer, we'll be in the Lowell Regional Lab Post and Regional Dispatch Center. We started scraping ground in Evansville for the Evansville Post and Laboratory. And I'll just say, unless you want to spend a lot of time on any more time on this, the other facilities were built when we just had a pipe dream about DNA. And then we built these facilities prior to DNA in the 1970s. Then along came this notion of DNA on tangible item. But now they're doing DNA with trace evidence that the human eye can't even see. And I would connect our laboratory system and the way it's managed to any in the country. And that doesn't happen without your support. So I'm very, very grateful. In regards to firearms tracing, which has become a really, really big deal, in about 19 months, our laboratory, specifically our firearms scientists and analysts, have been able to connect 903 guns to violent crimes. And that's just with the Indianapolis and the Fort Wayne facilities. So very proud of that. And it works in concert with the Indiana Guns Crime Task Force that you all allowed us to build in the last session, 2 sessions ago, actually, the last budget session in 2021. With tremendous success. It's my hope, I hope I see it, that we have every single gun that's in our custody, not just with the state police, but every police agency in Indiana, that we have that scientifically evaluated and analyzed and put into a system to give us a network of information about crime guns statewide. And I really think because of what you've allowed us to build, we're going to get there. And it's a big, big deal. Again, 903 guns connected to homicides, rapes, and very, very, very violent crime. The IMPD, who runs the Gun Crimes Task Force here that we participate in, is an overwhelming success. Overwhelming success. We do have, and I think it's worthy of mention, of drug backlog. I've had some questions from several members of this body, both from the House and the Senate, have asked questions about what that backlog is. Through a partnership with CJI, particularly with our drug backlog, we've been able to outsource some of those analysis and some of the work that needs to be done with substances that we get from all police agencies in the state. And we're making progress. COVID was a difficult time for you and for me. Nobody knew what to do, so everybody did the best they could. And Mickey explained to me today that some of the expenditures were being used as quickly as we did pre-COVID, particularly with the outsourcing, just because everything stopped on a dime. There's $1.1 million that we were able to receive, again, in cooperation with Zach and the crew, through the Indiana Criminal Justice Institute. We're down to about $200,000 and have outsourced around 6,000 cases or so. So that's really helped with our backlog, but we still do have one. We are able to expedite cases as needed, but every time we do that, we disrupt the flow of progress associated with those that are currently in the queue, like with any other process. So we have a really good relationship with IPAC and the prosecutors around the state, and we do the very best we can to meet whatever the request is that they might have. All crimes policing, you've heard me say that before. You probably don't remember it because I vaguely remember mentioning it to you, but the All Crimes Policing Initiative has to do with getting our troopers into local communities, getting them engaged with local communities with a specific focus on local crime. And we've had a lot of success there, just as we've had with our school system statewide and the number of people we've trained on active shooter or response to a violent incident, whatever it might be. So I would venture to say somewhere around 40,000 people. And we have a very, very strong depth of information on our website associated with what schools, as suggestions to schools. We had a PhD level person on staff for the last 10 years. He recently retired, and he was very instrumental, I think is one of the national experts when it comes to that kind of an event. In the school, we've had 2 of them in Indiana, one in 2018, one in 2019. And unfortunately, they may be coming again. I don't know. Internet crimes against kids, this is really important to all of us. I know it is. The state police is responsible to manage all of those tips that come through NCMEC, which is the National Center for Missing and Exploited Children in Washington, D.C. Extraordinary entity. So if a tip comes across through the internet, it goes to NCMEC, it comes to the state police. There are only 32 other agencies in the entire state that work these kinds of cases, and we call those are our partners with this kind of work. In 2022, or just in 2020, we had 8,400 of those tips come to us in 1 year's period of time. Those tips are prioritized. We do the very best we can. Certainly, contact or tips associated with a contact offender rise to the very top. But there are a whole lot of these that we just simply don't have the time to do, or the resources or people to do. In 2022, we're already at almost 12,000 in 2022. These are your kids and mine. And it's unbelievable to me that we'd be facing something like that in 2022, but the reality of it is we are. These detectives that work these kinds of cases are damaged. They're damaged. And we have a rule that they can leave whenever they want to. And I remember anecdotally early on in my administration 10 years ago, one of them looked over at me one day and said, "What do we do when we're done?" And I didn't understand the concept of what that question was, but I absolutely understand it today. I say that to you only to bring an absolute light on that responsibility that we have as an agency, and we're doing the very, very best we can. My job is going to be to continue to encourage local partnerships, local sheriff's offices and local police departments to come along with us. And that's been a bit more challenging than I initially thought. There's several other things associated with our drug enforcement, our commercial vehicle enforcement division. There have been a lot of things that have happened statewide that have drawn a tremendous amount of media attention and even scrutiny. So I think out of deference and respect for your time, I'll turn it over to you prior to the ILEA coming forward.
So what's next? You said who's coming forward?
The ILEA.
Well, I'll start with, first of all, I just want to thank you for always being accessible. I mean, you've been a great partner for us to work with. And I know I tell you this privately, but I also want to compliment Eric for the work he does at the State House because he always educates us. Yeah. So I thank you for him as well. So you mentioned recruitment, so that brings me to something that I'm getting a lot of legislation handed at me, and that's about this matrix. Yes. So I know I've met with people that have bills about the trooper pay, but it comes down to this matrix. So it's very complicated. And maybe just for the committee, you can explain how that would work. I mean, I'm not asking to advocate or anything like that. Maybe an explanation of So if they want to go from 20 to 15 years, I guess what I'm asking you is what does that mean? And how could that relate to improvement for recruitment? I guess that's what I'm asking you.
If we get somebody in the door, get them to apply, get them through the process, get them into the academy, mentor them throughout, send them out into the field, continue that mentorship into the field, we have to recognize that generation's different than us. That's frankly very hard for me. It's hard for me, particularly living in a paramilitary organization. But it's the reality of today, and we have to recognize it. Once we get them in the door and we get them out there on their own, there's a much higher likelihood that they'll stay. The other thing that we've noticed generationally is it's not uncommon for someone to leave to make an additional X, whatever that X is, or they get to do this where we don't. But what I will say is if they make that increased salary earlier than later, we can keep them. The longer we keep them, the higher likelihood is they stay. And our data will prove that. So the people that we're losing are those early in their careers. And I really believe that with all we've done, with all you've allowed us to do, with all the latitude the governor has given me, if we can get them in the door, we can keep them. So we take that matrix from 20 to 15, 20 to 10, whatever that number might be. That helps the people on the long end because they don't have to work 34 years to max out their pay. They can max it out earlier, the power of a dollar over time. And then on the front end, the faster they make it, the more competitive we become. So they won't look at other agencies to leave for a higher salary, as an example. You all have been really good to us, and the last salary increase we got was 24% in 2016. That was a big deal. That was a really, really big deal. Who would have predicted where we are today versus where we were in 2016? So I've had conversation with budget, with the governor's office about what that might look like, and I appreciate the conversation and the ability to have a seat at that table.
Because in the last budget, we just put some money in there and didn't change anything, but I'm just getting feedback that to really make it work, it's not a matter of just throwing money in the matrix, it's changing the matrix is where the real difference is. And I guess we'll just need to have continued conversation on what is that number? Is it 15? Is it 10?
Yes.
So I would just ask that you stay in that conversation with us because I know it's very complicated, so.
We will make ourselves certainly available to be able to drive down the detail associated with the number based on the percentage increase equal to that of a reduced matrix. And we will be able to do that as time goes on in whatever format you would like.
Well, thank you for that. Questions for Superintendent Carter? Senator Brown.
Thank you, Mr. Chairman. Thank you very much for your service. Again, you've also been very open and available. I would just have a question about that internet crimes against kids. I know Senator Kreider has advocated for increased expenditure in this area in the past. And I guess my question is, obviously, would totally support redoing the matrix and all of that because it is to think that we kind of throw money at this every 6 years or so is not a good way to do it. But I'm just wondering, is there ever been a thought to how to fund this kind of program in terms of pushing it out to the private sector, the business sector, any of those mediums, if you will, that are actually providing the platform for these crimes to be perpetrated?
Yeah, it's a great question, Senator, and the answer is yes. But we have to crawl before we do anything. And
You have to what?
We have to crawl. And what I mean by that is what's happened currently with local prosecutors being able to build a unit within the prosecutor's area of assignment counties, not just one, but counties, I think to do computer crimes, but not necessarily crimes against kids, is really a good test for us. And that was, I think it was 2 years ago, you all approved that. Yeah, it was, because it would have been it would have had a fiscal attached to it 2 years ago. So I think a continual evaluation of how that's working. I can't see us getting to the point, though, where we would ask a tech person to look at the disgusting images that our detectives have to look at. And we have to be very, very careful with those images. Be careful that we don't share them, number one. and that you only view them if you absolutely have to. So these people are trained as best we can train them to be able to process that in their minds. I can't see someone that hasn't had that experience viewing those kinds of events.
No,
or
I'm sorry,
photographs.
I think I was not clear in my question. My question was more, so, not the same, and I'm not suggesting this, but we fund 911 by a cell phone, or, right, a
Surcharge,
fee
right.
on our phone services in order, because we consider that. I'm just wondering, and this maybe not, but since we have all these huge budget asks and maybe a really tight budget season, if there is an alternative, because it seems like in my community, at least every week, if not every day, at least someone is arrested and prosecuted and sent to jail, prison for perpetrating crimes. And it's almost always through a social media aspect online somehow. And it just seems as if there was a fee imposed on these social media that are allowing this to be perpetrated. I'm just wondering if that would either make them monitor their own platforms better, and/or at least it would provide us with the ability. Because to your point, you're going from 8,400 to 12,000 this year. I mean, it's just increasing exponentially, and we're already behind the eight ball. That was my question. And I know that's not something you bring forth in terms of how to fund it, but maybe it's just something, a broader question we need to
Two quick
think about.
thoughts that I would have, Senator. I think the number in 2003 was somewhere around 2,200. In 2013 was around 2,300. So it's amazing what's happened over a decade. The next decade scares me to death. I think that, yes, anything that you can do to a social media platform that would hold them accountable, the better off we would be. And finally, I'll leave that on a good note. For the first time ever, we received, I believe it was $1 million for our ICAC initiative, thanks to you. Prior to that, it was all funded through grants, and that scares me. I don't think it's a long-term sustainable option, but those dollars allowed us to invest in our people, invest in technology, as you know, that's ever-changing. And I think you know well enough by now that we'll never do what we can. We'll always do what we should. So we're really focusing on sustainability and succession, particularly as I near the end of my run as the superintendent. I don't want to build something that we can't sustain, and I think it'd be irresponsible of me to do that. So I appreciate the thought.
Senator Gador?
Thank you, Mr. Chair. Superintendent, thank you for your service. You've been amazing. I have a couple of thoughts, a couple of questions. One, you mentioned on the guns task force, the success rate. To me, I opposed and I stood with you in support of your position in opposition to the permitless carry legislation, because I think you articulated that could potentially endanger the lives of police officers. From a budget perspective, if we're going to loosen laws that will increase the work for our guns task forces, would it be more cost effective to, be a little bit more strict on the front end of the system by trying to not loosen these laws so that the guns don't make it to the hands of criminals? From a budget and fiscal perspective, would it be more sufficient to focus on the supply side of guns rather than just the tracing side of guns?
That's a difficult question to answer quickly. I think it's almost impossible. Senator, I think that no matter what we do with gun laws, criminals are still going to have them. And what we have found with the work that we've done with guns doesn't necessarily need additional legislation from the criminal perspective. The issue with permitless carry back during that period of time was the roadside information that we couldn't access. And you and I spent a tremendous amount of time talking about that.
Yep.
So that's predicated upon a crime not have been committed yet. But once those crimes are committed, I think you all would expect us to go after them and go after those guns if we can. And frankly, we're limited with what we can do with individual people now. So now it's come to trace technology. Trace technology associated with guns is near absolute. I hope that answers the question.
I appreciate it. I'll send you my legislation on this for next session to get your thoughts. My intention is to protect police officers because they serve our communities. My brother-in-law was killed at the age of 25. I made my position very clear on this issue. This is not a partisan issue, and shame on us for passing laws that endanger police officers. I'm very passionate about this issue and have very strong feelings about it. But the second and the final question, I'll send you my second draft of legislation specifically to fund our statewide police officers to invest in community relations and diversifying recruitment. So I'm suggesting a $25 million fund on an annual basis to fund police departments across the state to deal with the issue of recruitment and diversification and building better relationships with our communities, because that strong partnership is going to help us solve crimes and be more preventive on that side. So I would appreciate your agency's feedback on both pieces of legislation, and I look forward to supporting your work. Thank you.
Thank you, Senator.
Anyone else? All right. So we'll jump to Aliyah then. All right, thank you.
Afternoon. Good afternoon, sir. My name is Tim Horty. I serve as the Executive Director at the Indiana Law Enforcement Academy, and I'm grateful for the opportunity to share our story here with you today. The mission of the Indiana Law Enforcement Academy is to be the center of law enforcement education from Evansville to Gary. We prepare new young officers to serve in our Hoosier communities, and there are approximately 17,000 full-time, part-time, and reserve police officers that work in our great state. We teach these officer skills in the classroom, like with topics that include de-escalation, community relations, community policing, race relations, dealing with the mentally ill, as well as criminal law, and a new topic that we've got recently is called emotional intelligence. We use scenarios that we use to base our training to reinforce the skills that these adult learners have developed over the years. We also teach the hard skills. And sometimes those are looked upon a little differently than the softer skills, but we teach them physical tactics. We try to make sure that they are physically fit every day. We teach them about firearms. We teach them not only how to shoot a firearm, but when to shoot it. We teach them with defensive tactics so that they can make sure that our communities are safe as well as protect themselves. And then we also teach emergency vehicle operations that teaches them how to drive in emergency situations and on an everyday basis. We are proud of the officers that we have trained. This year, we've trained 503 basic Tier 1 and 2 officers. These are folks that work in our cities and towns, as well as our hospitals and the Department of Corrections. We asked our chiefs and sheriffs almost every graduation to make sure that we are producing a product that they are happy with. And up to now, they say the quality of what we're producing is very well developed. In large part, we do due to your funding generosity, we have learned to move more aggressively to a scenario-based training model. It's a more realistic view. It is more reality-based. It's more of a hands-on learning situation, and it helps build skills over time. As the superintendent mentioned, in our generation, we sat in a classroom for 20 weeks. We took a test, and the last 2 days of recruit school, you went through scenarios. That's not how we do things now. We build on the things that we have learned over time and hopefully have developed an opportunity for these young men and women to make mistakes in recruit school, not where they are working full-time out in your communities. The legislative funding that we have been given up to this point, through your graciousness, we have been allowed to move into a post model of law enforcement training. It's called Police Officer Standards and Training. The standards and training, we make sure that the curriculum and the testing is standardized around the state. It helps develop a standardized curriculum within all the academies. The Law Enforcement Academy in Plainfield is the mothership of sorts. There are 5 other academies around the state that we are responsible for making certain that the standards are up to our high standards that we have with the Law Enforcement Academy. We also are using the funds that you have given us for additional facilities. We are proud of putting officers in our cities and towns, and one of the first facilities that we plan to build with the money that we have been allocated is an emergency vehicle operations track. That is the number one issue, number one place where our law enforcement officers are being killed around the state. It's the number one killer here in the state of Indiana. So we talk about pursuits, we talk about their abilities to drive the cars, we make sure that they know their limitations and preach every day about due regard. And when we say due regard, we mean that when the danger to the public outweighs the importance of an apprehension, we teach that those pursuits have got to stop. The other facility that we plan to build is a dormitory. The dormitory is, our academy is the only residential facility in the state. Doesn't make sense for officers from South Bend to commute every day, those folks from Evansville. So we're planning to build another residential dormitory. That way these folks don't have to commute. It's modest, but it's practical and functional. We'll have full IT amenities when we are finished. The crown jewel of our facilities will be a scenario-based training village. This village will be a strip mall of sorts. It's an opportunity under a covered circumstance to make traffic stops. We will have classrooms. We will concentrate on de-escalation within our training facility. We'll have a cul-de-sac where officers can use mock training sites for mental illness runs, domestic violence runs, crimes in progress. And again, it's an opportunity to learn on the job, not just in the classroom. We use a critical decision-making model that these officers are engaged in, and they develop their information, they develop a plan, they implement the plan, and then redetermine whether that plan was solid. So again, the scenario-based training village that you see here is the crown jewel of what we are trying to do with our scenario-based training model. The 24 funding also allows us to have a better student-teacher ratio. It's easy to stand in front of a recruit school and teach 140 at a time, but again, that's not the way adult learners learn. I heard Secretary of Education Katie Jenner say recently that you learn to read and then you read to learn, and that's exactly what we're doing here. We're learning the skills and then we're teaching them how to implement those skills as we go through. So we'll hope to build a better student-teacher ratio and then maintain the new structures that we just talked about. I am proud, I am flattered to work in a state where legislators like yourself understand the importance of funding law enforcement and understanding that we get what we invest in. And these are officers that are in every one of your neighborhoods. I venture a guess that you all live or work in a county where the young officers come to our facility and are trained. So again, I'm grateful for your stewardship and grateful for the understanding that we need to continue to invest in our law enforcement officers.
Are you going to be requesting the money for the dorms in this budget?
It'll be in the 24, 25. No, forgive me. That money has already been allocated. Yes, sir.
For the dorms? I thought that was phase 2.
The dormitories, the emergency vehicle operations track, and the scenario-based training village are all part of this.
So the dorms were part of phase 1.
Yes, sir.
So what's phase 2?
When this issue first came up, now, 2.5 years ago or so, we had a pretty good idea what it was going to look like. We didn't know exactly what it was going to cost, and we really didn't even have, or could we articulate the absolutes associated with the long-term investment and the why that we owe you. So with the $70 million that was initially appropriated in 21, allowed us to really take a long-term view of what does it look like in the future and how do we work that project backwards. Then COVID happened, so it slowed everything down. I've had questions from some legislators saying, hey, is it done yet? And I don't blame them. That's a really good question since we've had the money now for almost 2 years, but we took a very measured approach to the why associated with the investment. And the initial investment is not going to get us to the end. We don't know what that middle piece is going to be, but in pretty short order we will. From a very high level, what we've also found and what Brian Renner has explained to us over time, the value of consistency and continuity in the building project is important, and there's absolute cost savings to it. But again, budget has been a good partner here, and we'll have more information as we push forward.
So
From
phase
capital.
2 is really going to be additional costs of the entire project?
Yes, that's
It's not an additional part of the project?
Both. There'll be
Okay,
an additional part of the project that we believe will meet our needs for 20 or 25 years when we're done, but that would require an additional investment.
but not for this budget?
That's hard for me to answer. There likely could be, but I don't know what that number is.
Thank you. Any questions? All right. Thank you very much. Next, we have DWD and Commissioner Adams. Huh?
Good afternoon. Oh, excuse me. Why don't you pull one around?
Floor is yours.
Thank you very much. Good afternoon, everyone. My name is David Adams. I'm the recent commissioner of the Department of Workforce Development. I've been with us a little less than 3 months. I'm excited to be here. I think this is one of the most important roles in our state. I think workforce is an issue that we collectively have to work to address for our state, so I'm excited to be taking on this role. With me today, though, to help provide some additional domain knowledge, because we're going to talk about some of the successes of the last couple of years, as well as our budget request moving forward, is I've got Josh Richardson, who was the acting commissioner prior to my arrival. He also has a tremendous amount of domain expertise, both from an administration, operational, both inside the four walls of DWD and within the community. And likewise, I've got Deanna O'Wary, who heads up all our financial operations for the Department of Workforce Development, and we'll go through our budget request, and we'll be happy to answer any and all questions that you may have. Before I get into some of the accomplishments and the budget, I'd just like to remind us all about what does the Department of Workforce Development do. We administer, on behalf of the state, both federal and state programs, focus on a variety of different constituents throughout the state. We also administer, on behalf of the state, the federal program for unemployment insurance. In terms of the organizations we interface with, there are 12 regional workforce boards throughout the state of Indiana, and we work to administer the funds through them to help support the local needs of their specific region. We also work with the Governor's Workforce Cabinet. The Commissioner has a seat on the Governor's Workforce Cabinet. We review the plans that the regions submit in terms of how they're going to address the needs of their specific region, and the Governor's Workforce Cabinet, in combination with us, approves those specific plans. We also work with various agencies, including the Department of Education and the Commissioner on Higher Education. Workforce, again, is a community issue. So with that, what I'd like to do is see if it'll advance for me. Talk a little bit about some of the accomplishments for the past 2 years. And if you think back to 2020, when COVID hit, unemployment here in Indiana approached 17%. And with that, we had nearly 1 million claimants in unemployment insurance. And the trust fund, which is where the payments come from, was approximately $900 million at the time. We are currently sitting at an unemployment rate of 3%. So we're at full employment here in the state of Indiana. And we're currently at about $1.2 billion in terms of the trust fund. And again, this is dollars that would be used to pay for unemployment benefits. And in comparison to the 1 million people that were actually getting payments during the COVID outbreak, we're at about approximately 18,000 claimants as we sit today. There are 2 grants that you have us administer on behalf of the state. One is the Employer Training Grant, and the other is the Workforce Ready Grant. These are 2 grants. One, the Employer Training Grant is focused on new and incumbent workers, and the Workforce Ready Grant is focused on individuals. And by the way, let me just back up for a moment and talk about, from a workforce development standpoint, the programs that we have responsibility for administering. So from a federal standpoint, we have something called the Workforce Innovation and Opportunity Act, or what's typically referred to as WIOA and Wagner-Pizer. This is focused on low-income, unemployed, and underemployed individuals, and there's programs through the regions that get administered to support those individuals. We also have programs like Adult and Basic Education, which are focused on basic skills development for individuals. That is also a federal program that has a required state match associated with it. We also have programs like Jobs for America Graduates, the JAG program, that is a state-funded program. And then, of course, we have things like the Employer Training Grant and the Workforce Ready Grant that are state-funded programs. So we have a mix of federal programs and grants that we go after and that we administer on behalf of the federal government for the state of Indiana. But there are also a number of state programs that you have legislated for us to administer. So with that, getting into the Employer Training Grant, and I just want to share with you what skews these numbers somewhat that I'm going to provide you, is the fact that we also had CARES money that came into the agency during the time period. But we had approximately the last 2 years about 11,000 individuals that are either employed or going to be employed that leveraged the Employer Training Grant. And since its inception in 2018, there's been approximately 1,700 employers that have participated in the program. Now, in terms of industries, just to give you a flavor of the employers that are taking advantage of this, about 1/3 of the industries are in the manufacturing sector, about 1/4 or 25% are in the health and life sciences, about 20% in building and construction, and about 12% in the IT business services. About 3/4 of the businesses are less than 200 employees. So if you can think about the regions, just the demographics throughout the state, a lot of the employers are taking advantage of this, have less than 200 employees. And then from a Workforce Ready Grant standpoint, again, there was CARES money that was infused into this. But just in the last fiscal 22, we had approximately 6,400 individuals that took advantage of this particular program. And again, if we look at it from an industry standpoint, the individuals taking advantage of this program around the industries that you authorize us to do, about 32% of those were in health and life sciences, 25% in transportation and logistics, and 22% in building construction, and about another 16% in IT. Again, these are individuals looking to get the credentials to work towards gainful employment. The way that particular program is administered is on a 70-30 split, so the provider would get 70% of the funding up front, and then upon completion of that particular program, there would be another 30% allocated. Some of the data would suggest that we've had about a 92% completion rate, with about 77% of the individuals that have gone through the program receiving a credential. A program that is a federal and state program is the Adult and Basic Education Program. Again, this is a program designed to help individuals get skills, basic skills around math, could be reading, could be English as a secondary language. And in the last 2 years, we've served approximately 49,000 individuals. And again, these are activities that we work with the 12 regional workforce boards to administer. About 70% of the individuals that have gone through this program are employed after 4 quarters of exiting the program. So the whole intent here is how to provide services to individuals that may not have the basic skills necessary to get a job. And then if we keep working downstream for students, and these are individuals that are in programs where there's a concern of whether or not they're going to complete high school or not in underrepresented, low income. And again, these are programs, there's about 120 of these throughout the state of Indiana that we, again, work with the regions to actually determine what those programs are. We've had approximately 6,600 individuals in the last 2 years go through that, and 94% of those have actually completed and graduated from high school. I'd also just like to note that in terms of those individuals that have graduated, approximately 35% have gone on to pursue something beyond high school education in terms of postgraduate. And then likewise, the last one I want to talk about, because these again are all related to funding requests that we're putting before you, is our apprenticeship program around work-based learning and apprenticeship. This is a federal grant that we've received. There are dollars associated that we're requesting from the state to help us with the administration and outreach associated with it. You'll see it's a lesser amount. But in terms of this program, we've had approximately 3,700 completions. And this is, again, as we're an employer, is working with the provider to actually create an apprenticeship program for employment. We've had over 1,000 active apprenticeships developed to date with an average wage of about $23 an hour. And in terms of looking at this in terms of numbers that we've done, currently we're ranked #1 in the nation in terms of the registered apprenticeships per capita. But again, the idea here is how do we, from an employer standpoint, better understand their needs and then work with providers to develop specific apprenticeship programs to be able to support that. So those are just a few of the highlights that we wanted to go through relative to what the team has been working on the previous 2 years. And with that, I'd like to ask Deanna to talk a little bit, because this is all related to the appropriation request that we have before you, and then we can open it up for whatever questions may be on your mind.
Thank you. Before talking about the budget request, I just wanted to provide a high-level overview of our funding structure and how much money we receive from all sources. So in a typical year, pandemic excluded, we receive about $200 million from state, federal, and dedicated resources. Our primary funders at the federal level are the Department of Labor, where we receive funding to administer the unemployment insurance program.
Yes, sir. Oh, sorry.
Where we receive funding to administer the unemployment insurance program, and the Workforce Innovation and Opportunity Acts program, which provides funding for career and employment services serving disadvantaged youth, adults, and dislocated workers. We also receive federal dollars from the U.S. Department of Education for our Adult Basic Education program and the Corporation for National and Community Service for the state Serve Indiana or AmeriCorps program. The state general fund appropriations are very important for our agency, and they allow us to provide funding to the programs referenced on the table that you see in front of you. And in some cases, they complement federal dollars and provide flexibility to the populations that we can serve and allow us to serve more Hoosiers. State dollars also provide some administrative and programmatic operational support. And so our funding request for the biennium is $47.6 million in fiscal '24, which is about a 13% increase over our current year. And we're asking for $51.3 million in fiscal '25, which is about a 21% increase over our current year. But when you compare the requests for '24 and '25 to the 2021 budget, the increase in that first year is 2%, and in the second year is about 10%. We are requesting some budgetary increases or change packages in 4 areas. The first one is adult basic education, where we're asking for $3 million more in '24 and $6 million more in '25. And this allows us basically to administer the adult basic education program and administrative costs, the purpose of which is to offer basic academic skills toward higher levels of educational attainment, including a high school diploma, a high school equivalency, and/or transition to post-secondary education and training. There are roughly about 430,000 working-age Hoosiers who do not have an HSE or high school diploma, And annually, the adult basic education program enrolls about 20,000 adult learners. So the increased funding for that first year will allow us to serve approximately 2,500 new adult learners, and in the second year, about 5,000 new adult learners. The second change package that we have on the list is for the JAG, or Jobs for America's Graduate Program, also known as Dropout Prevention. And we're essentially restoring the funding levels in 2024 and 25 to what we received a couple of bienniums ago in 2020 and 21. So $8 million in total for that. And the JAG program is a state-based national nonprofit organization dedicated to helping high school students of promise who have experienced challenges or traumatic life experiences, and we help them achieve success through graduation. The JAG is a resiliency-building workforce preparation program that helps students learn in-demand employability skills and provides a bridge to post-secondary education and career advancement opportunities. JAG students receive adult mentoring while in school and 1 year of follow-up counseling after graduation. Indiana's program consistently graduates 95% of the participants, and students choose to then continue their education after high school more directly into the workforce or enlist in military following graduation. The current JAG program offers 121 programs in various schools, and the additional funding will allow us to create about 12 new programs in schools in fiscal 24 and 25. The third request is for additional funding for the Workforce Ready Grant. And so currently we receive $3 million. We're asking for an additional $3 million in both fiscal years so that the appropriation will be $6 million in both 24 and 25. The Workforce Ready Grant is a program that allows Hoosiers to enroll in training programs in one of Indiana's high-demand fields, which are advanced manufacturing, building and construction, health and life sciences, IT and business services, transportation and logistics. The Workforce Ready Grant targets in-demand occupations that are within high-growth sectors of the economy. And we currently serve only about 4% of the requests that we receive for training. And so this additional funding will allow us to serve an additional 500 to 600 more Hoosiers in a year. And then our final request on a change package is for the general administration line. And as Zach mentioned last week, the initiative that we are requesting funding for is additional state personnel IoT healthcare costs in the first year, and it's about $1 million increase. And then in the second year, those costs as well, SPD IoT healthcare, and also funding for an internal audit unit for fiscal 25. So it's about a $1.7 million increase in that second year. And that completes the budget request for the agency for this year. Questions?
Senator Brown.
Thank you, Mr. Chairman. Thank you very much for your presentation. So if I have this right, for your Workforce Ready Grant, it's about $6,000 per person, the spend is that right?
Roughly.
And then for the, you don't have numbers, you just have number of programs for the JAG, so I can't figure that one out. And then for the adult basic ed, if I'm only taking half, it looks like $17,500 per person. Is that actually correct?
No, it's about $1,300 per person. So you're only looking at the general fund piece of the appropriation. So in total, we enroll about 20,000. And so from all funding sources, the general fund dollars plus the federal dollars, which are not reflected on this table, it's the cost per training is about $1,200 to $1,300 per student.
Under the adult basic education?
Yes.
For the state or total spend?
In total, yeah.
Okay.
It doesn't vary with federal or state.
I guess I have a concern that so are you looking at, so you said 200,000, so almost 500,000 don't have a high school diploma, and about half of them are not in the workforce. So what's your goal? To get them a high school diploma or to actually get them working? Because I guess I have a hard time looking at, there is literally not a business that I know of in my community that is not hiring. And many of them have done away with the most minimal educational requirements. Some have even done away with drug testing requirements. So what's your metric? You can tell me later. What's your metric to show success? And I'm trying to figure out where the best bang for the buck, because then I'm not even going to ask you the number, because you just talked about the programs for the JAG dropout prevention program. And that seems like if they're already in high school, and you mentioned many or some, my words, many, are going into the military, which is appreciate their service. But isn't that a high school issue, the K-12 issue, rather than workforce development issue that you are working on? What's your metric for what's the success in these?
Well, ultimately, Senator, I can tell you, been here less than 3 months, but the measure for success is going to be employment. Are we helping people find jobs? And that's what's critically important. And how do we help individuals first get from low wage to mid-wage and from mid-wage to high wage? And how do we help bring the working population, the 3.4 million Hoosiers, how do we help them bring them along throughout the pathway of their career, if you will? So it is ultimately not just to get them to high school equivalency or diploma. It's how do we continue to help them upskill and develop the skills they're going to be needed long-term throughout their career. And that's what we have to, as the Department of Workforce Development, really focus on moving forward.
Okay, well, the main piece, the Workforce Ready grants, that's a huge spend per person. So at what point do the businesses need to match that? And at what point do we just say these people we can't force them to get a job, right?
So you're asking a great question. So if you think about, it's really closer to 5,500, but if you want to use the 6,000, it kind of gives you a flavor. We're impacting 500 people. If you think about the overall workforce of 3.4 million, it's a very small percentage. So, one of the things that I've already talked to the team about is we're gonna really take a look at the overall process and how do we leverage, in your specific example, potential matching amounts of dollars towards these grants. And are there other resources that we can bring to the table? So in other words, we get that $5,500, there's an opportunity to get an employer to match, all or a portion of that. Those are things that we have to look at from a process standpoint.
Yeah, particularly when it's an adult with some college, when we have Ivy Tech offering a lot of free programs, when we have now our state government offering free Ivy Tech. We have all of these programs out there. So anyway, thank you, I appreciate it.
No, thank you.
Senator Cador.
Thank you. One technical question. Last week, I asked Ivy Tech when they presented, I'm interested in expanding the Workforce Ready grant to cover an associate degree. LSA told me that it currently does cover an associate degree. When I asked Ivy Tech last week in this committee, they said they were not aware that the Workforce Ready grant covers an associate degree. So our legal team looked into it, and they thought maybe there could be some nuances between the Commission on Higher Ed and DWD as far as your internal policy of what the Workforce Ready grant qualifies for. Can you help me settle this issue and understand from DWD's perspective, does the Workforce Ready grant cover an associate degree at a 2-year institution such as Ivy Tech?
There is a credit-bearing component to this, and there is a non-credit-bearing component. We are currently administering the non-credit bearing piece of this. Commissioner of Higher Ed is administering the credit-bearing. So I'm happy for us to get with the Commissioner of Higher Ed and actually clarify that for you and get back to you.
I sincerely appreciate you, because as we're looking at workforce retention strategies, one thing that I'm thinking through is if we expand it to STEM field and advanced manufacturing and these on-demand types of skills, taking it from 1-year types of certificate kind of grant to 2 years would be helpful. And Ivy Tech explained to us in committee that even though the state DWD funds its last dollars in, meaning that, with all grants, support, scholarships, all of that, the Workforce Ready grant just fills that last gap. So it's really an effective way to get people trained and all of that. And I think maybe if we expand it by 1 more year for an associate degree in specific targeted areas like advanced manufacturing, technology, computer science, would be very helpful. So please get me the answer to that, and I appreciate the work that you do.
We absolutely will. Thank you.
Anyone else? Representative Cherry.
Thank you, Mr. Chairman. Earlier today, we had the Secretary of Education in explaining rethinking high school education and doing a lot of workforce training and getting credentials so people can move up to a higher level. And I know the Ivy Tech is doing it. Maybe they're doing it for some type of credentials, but credentials are important. It's something that someone participating can have something. You can't take it away. But I would suggest utilize some of the existing programs out there. Even Vincennes has a good program for in workforce and machinery, and I would say utilizing those facilities across our state would be very beneficial, because they're trying to do the job, you're trying to do the job. We need to all, the left hand all know what the right hand is doing. So that's all I have to say.
Representative, thank you so much for your comments. In fact, we are the department that's charged by the state with workforce development. Doesn't mean everything has to happen within workforce development to be able to support that. In the short time I've been here, it's very clear that not only are we doing a lot, but there are also a lot of commercial providers out there doing a lot too. It's my goal during my administration here to help us figure out how to coordinate on behalf of employers and really help support the development of the workforce to support what they need, and leveraging not only state resources, but where we can, leverage outside resources to be able to support that. So really appreciate your comments.
Anyone else? All right, thank you.
Thank you very much for your time.
Next, we have IDDC and Elaine Beadle.
Okay.
So we're 30 minutes behind, so I moved your time from 4:30 to 4:45, so.
Perfect. And thank you all, because I know it's been a couple of long days, and you've been sitting here with some pretty important challenges being presented to you, so I appreciate your time this afternoon. I am Elaine Beadle. I'm the current chair and CEO of the Indiana Destination Development Corporation. I have some information to provide, so I'm going to talk fast, so hopefully you can listen fast. The IDDC was created in 2019 by legislation that you passed to replace the Indiana Office of Tourism Development. However, it had a much broader mission than that. Our mission is not just to bring people to the state to enjoy our attractions and what we have to offer, but also to promote, brand, and tell Indiana's quality of life story to attract and retain talent, graduates, and visitors, and along the way to help increase Hoosier pride. I mean, there's a situation that we have in Indiana that we aren't very well known by those outside, and we'll show you some of that. So today I'm going to try and tell you about the current situation, what we have accomplished in the past, and what our plans are for the future. So the current situation, we've done a lot of research, and we've done image studies, we've done focus groups, we've done interviews with talent recruiters, and this may not come as a surprise, Indiana is not well known outside of our borders. In fact, if there's no connection, in other words, you never visited here, you don't have friends or relatives here, you didn't go to school here, you have no perception of what Indiana's all about. You hardly know where we're located. And we also found that a lot of people had no information, and those that did have information, a lot of times it was misinformation about Indiana. So I want to share with you what some of our focus group actually how they responded to this, if I can do this. Is the sound working on this? We need the sound. Okay, Senator Mishler, I've got to get a little extra time for this technical difficulty. You know, it's just like a soccer game. You got to add that extra time for at the end of the game, make it fair. Oh, okay. I'll be quick. I'll be quick. Still no sound. We should have had sound by now. Well, what you're missing is a lot of individuals giving their thoughts and the perception of Indiana. Are we going to be able to get the sound, do you think, or are we giving up? Sorry about this. Basically, you probably wouldn't be very happy to hear it all. It's very disappointing. In fact, it's not what we want people to think of our state. You need to go back one there. So no sound? All right, darn, because you're going to miss some great videos. Well, it was not very pleasant. Most of them said they think Indiana would be boring. First of all, the focus groups were in Chicago, Atlanta, and San Francisco, and you had to be willing to move for a job to be part of the focus groups. And basically what they were saying is that they didn't know anything about Indiana. It was boring. It would be all cornfields. There's nothing really there for them. They wouldn't come. So what are we going to do about that? We've got to tell our story because nobody else is going to tell it if we don't tell it. And so the problem, so what we did is I think we're back one. We decided to promote our state. Our $4.7 million budget that we have now allows us to use maybe $2 million to $2.5 million to promote the state. We did get some EDA funds this past year. $5.6 million were allocated to Indiana on a non-competitive grant. We chose to use $4 million to help promote the state. And so that is from spring, summer, all the way through the rest of this fiscal year. We used $1.9 million to do some advertising in 3 markets, because that's all you can afford with $1.9 million, and that was Chicago, St. Louis, and Louisville. And we think the results from this were very strong, and it really tells our story of what we're trying to accomplish. We used a third-party analyst group called Longwoods International. Longwoods is recognized nationally and internationally for doing this kind of work in the tourism industry, determining what the return on investment is for the dollar spent in advertising. So they decided they concluded that $1.9 million actually motivated 864,000 incremental trips to Indiana. When those travelers came here, they spent $102 million at our Indiana businesses. And it comes down to $11.2 million in new taxes created by that spend. Now you might ask, how are they coming up with the tax number? They used, again, another third party called Rockport Analytics. Rockport has been doing our economic impact report for many years, so they know the state well, as they've done it for other states and around the world. They use 11% as the tax rate. That includes sales tax, food and beverage, hotel tax, gas tax, anything that a consumer spending dollar or tourism would spend dollars on. And so what that comes down to is that for every dollar that we spent marketing Indiana, we received $6 new in taxes, a very positive return. I had no idea what to expect. I didn't know if we'd expect $2, but that's still good. If we'd get $3, but we got $6. That means as an investment person, I every day go for, I'll give you $1 for $6 in return, and that's exactly what we're seeing here. And you know, I checked to see, is this reasonable? Longwoods did their analysis for Michigan in 2021, and they got $8.79 per dollar. Ohio got about $6, same as us. Kentucky got about $5.25. So we're right in the ballpark with what that is. So I think this is an important thing for us to recognize, because we're bringing new money into, because we're bringing in visitors who are spending dollars, who are creating taxes for our coffers. Our budget is currently 4.7 million. 5.8 when you take out the pass-throughs to FFA, to Indiana Sports Corp, to a couple of museums, we're about 4.7. The proposed budget for fiscal year 24 and 25 is to add 10 million, so we'll be at 14.7 million. We're being grossly outspent by our neighboring states. And in your folder, you're going to see this same map that shows the dollar amount. Pure Michigan, with their campaign in Michigan, has been doing $40 million for several years. Ohio at 35, Kentucky at 45, Illinois at 104. We are grossly outspent. We can't get our story out there. You probably see ads from all of them, commercials, come to Illinois, come to Michigan, Kentucky, Ohio, wherever. And most citizens think, oh, well, we're doing that in their states as well. We're not. We can't afford it. And so that's not happening. We are not telling our story anywhere. So to move from that, we did create some new messaging. So what did we get done this year? One of the things that Indiana has in the past, it had taglines. It's been, you know, honest to goodness, Wonder Indiana, whatever. And the problem with those is not everybody can get in, jump in and support those. Maybe it worked for the state, but it probably didn't work for anybody else. And what we needed to do is create some kind of messaging that everybody would pick up so that we get a really big megaphone out there talking about what assets are Indiana. You know, right now, Purdue, that's in Indiana. Notre Dame, that's in Indiana. Lilly, that's headquartered in Indiana. I get those questions all the time. And we've got to, again, let people know what's here. So the identifier is in Indiana. They create their own headline. So it's adaptable for everyone, and it complements and doesn't replace their own marketing. And again, it's all to build up this body of knowledge. We created toolkits. There's actually 4 of them, and if you look at your little card that's in here, you can find the toolkits by just using the QR code. General, municipal, business, and college and university. We have got templates in there if you want to make banners, if you want to do newsletters, if you want to do emails, if you want to do postcards. It's all there, the font's there. There's a quick start. All you need to do is type in your headline, download, and you can put it on your website. You can see some examples there. Life is better in Indiana. More to discover in Indiana. That is a beautiful mural. If you travel south on I-465 on the east side of Indianapolis, you might have seen that one. But these toolkits are free for everybody to use, so anybody can pick it up and use it. And I might say that everything that we create, all the videos that you're not going to be able to see today, but I had in here, they're free for people to put on their websites and to modify them and use them however they want. We had a kickoff June 8th. The governor and lieutenant governor were at the Indianapolis Motor Speedway for the kickoff. Since that time, we have had nearly 350 documented activations. Now, we know there's other out there that people haven't told us about yet, and others are working on getting it there. It takes a long time for some marketing organizations to kind of get that up and running, but we're pleased with that outcome, and there's 46 murals around the state that are all about their community, but with the In Indiana activation. We also created a great video that I'm not going to be able to show you. It is, however, on our website. If you go to visitindiana.com, you can play this video. And again, it talks all about all the wonderful aspects of Indiana. I'm, again, sorry we can't. I can try, but I'm assuming the sound hasn't been fixed.
Elaine, one thing to think about is you could email that to us, and then we can view it on our computers, the ones that don't have sound.
Right now?
Well, I mean, not right now.
Afterwards?
Afterwards, yeah. Email it to us so we can then see the videos.
Thanks, that's a great idea. Thank you. But you can just kind of see from the pictures, it really outlines all of wonderful things that we have going in our large cities and our small towns in Indiana. And it always ends with, nobody believes that picture, that place is in Indiana. Nobody believes the dunes are here. It's amazing. Anyway. So again, the identifier in Indiana, put your text there. Here's some examples of some of the headlines that have been used around for our identifier. Here's some actual examples. E is for everyone. Evansville has used that in their website and in their marketing. We've got Indiana State picked it up for their student recruitment. You know, discover your advantage in Indiana. We've got Visit Indy, which is our largest destination marketing organization right here in central Indiana, used it in a lot of their summer campaigns. Family Fun in Indiana, Summer Memories Await in Indiana. We love that. And just to show you, Visit Knightstown in Indiana. Knightstown's a small community. They don't have much personnel to do any of this marketing. They could easily download and create this and put this on their website. So it's really something that every small community in Indiana can work with. And of course, we've got the Motor Speedway back home again in Indiana. Doug Bowles was kind of our master of ceremony for that press conference, and at the end he was throwing out all kinds of creative headlines that they would be using. This is May in Indiana. Rev your engines in Indiana. And a business owner can just say, I'm a proud business owner, or can identify themselves as minority-owned, woman-owned, or veteran-owned, and put that on their website, et cetera. And we worked with the Department of Natural Resources, obviously, to promote our state parks and other recreational areas around the state. I'm, again, just trying to hit some highlights here, but we did have a kind of a redo of our website, visitindiana.com. It still has all the visitor information, but we've got another section called Move In, and it really talks about the quality of life. What would it be to live in Indiana? What would it be to work here? And these live-in pages are based on different regions of the state, talking about all of their qualities, and then actually showing some of their individual things linking to their website. Cost of living calculators, school information, scholarship information. We're actually partnering with DWD, FSSA, DOE, INVETS, as well as DNR on some of the things that we have there. My philosophy has always been, if it's somewhere else, don't reinvent the wheel. Just work with them and pull that in as well. ZipRecruiter, we've got a collaboration with them. If you go to the website right now, you'll see over 26,000 jobs in Indiana that someone can access through this website. The whole idea is when we get somebody there, give them as much information as they can to understand quality of life. We did an awful lot of videos, again, none that you'll be able to see, but we'll email them to you. And a lot of that people can customize. So if you look at the very bottom, I said graduate retention videos. So there's a video that we've created all about, what students can do in Indiana and the importance of getting outside the classroom. So a college can take and put their information on the front end and the back end and use it on their website, use it in orientation, use it in recruiting, however they'd like. We've got also a quality of life video that corporations and municipalities can do the same thing. Again, talking about that. We are going to get down to doing 11 different regional videos so that the different regions in the state can really put a lot of just their things there and their assets and their attractions. So we're pleased with that. And hopefully you've seen some of our first-person videos, the Hoosier by Choice videos that we have been doing all the last year. They're heartwarming stories about people who moved here from somewhere else, and they tell you why. But the problem is we got to get them here, because once they get here, it's like, I love it and I'm never leaving. And we know that's the case. We're now starting to create home again in Indiana for all of our Hoosiers who moved somewhere else and chose to come back, and they tell us the reasons why they're doing that. Everyone thinks grass is greener somewhere else, and they're learning that it's not always the case. Again, here is a video of that, and then we had another video that would have shown there, so we'll get that to you. We are running some pilot programs beginning of 2023. A College Life in Indiana on-campus promotional pilot that we're going to do with Ball State University. It's really helping to support the College Life passport that we created and get students off campus. With the city of Fort Wayne, we're going to be doing an intern networking pilot where businesses all over that region have interns every summer, but those interns don't know each other. They don't know who else is there. So we want to get all of those interns together so they have a social group, get them to understand the community and to enjoy the community so that they can think of living there and getting engaged in that community from that experience. And the third one is a digital photo booth. Now, these aren't for glamour shots. These would be put in the Indianapolis Convention Center and then taken to some other major events where people could get pictures taken with their friends, and behind them they would have either a scene of Indiana or a personality might virtually come in, like the governor or any of our other personalities in whatever that region is that we are, get their picture taken. And of course, to get their photo, they have to give us contact information. So we'll get either a cell phone or an email that we can then turn around and continue to give them some information about Indiana. We'll get their zip code as well, so we can start then comparing. What's it like to buy a house where you are versus here? What's the cost of living here versus there? So all that information will be provided out. So plans for additional funding. We'll be scaling back quite a bit because we're not getting quite what we had hoped for, but the idea originally was that 80% would go into media spends. That would be our advertising. And if we can, the more money we put into advertising, obviously, the more money we get back into our own coffers. So again, that 6-to-1 ratio. But we also feel like we need to provide some state leadership to help the other destination marketing organizations around the state. We have a wide variety. Some have a lot of talent and resources and personnel, and some are one person kind of running the show. So giving a little more support in those kinds of things as well. Co-op programs, and what a co-op program is, they put in $50,000, we put in $50,000. We do all of the marketing strategy for them. We create the video or the ads or whatever, and then we put them into the markets that most help that region. It helps them, it helps us, and it boosts our dollars. We need to do more of that. We need more money to do some of those kinds of things. Right now, we can do maybe 4 to 6. We'd like to do quite a bit more than that to help our other regions of the state. Regional collaboration, we need to incentivize. We need to have more incentive programs for talent attraction. We need to measure more ROI and best practices and share those around as well. Additionally, we have grant programs. Right now, we can grant maybe $250,000 or $400,000 to $400,000, which is matching funds normally to help a community increase their museum, to make their park better, do different things like that. We'd love to do a lot more than that. And what I'd really like to focus on is trying to help attractions move to the next level. We have already taken an inventory of many of our attractions and ranked them as international, national, and regional. The only international we want to have in Indiana is the Indianapolis Motor Speedway. Everybody comes for the Indianapolis 500 globally. We have national, a few national. We have Dunes National Park. Obviously, we have French Lick and some other national draws here in the state. But we have an awful lot of regional. Wouldn't it be great if we could do something to enhance that regional attraction to make it a national attraction so that we bring even more people to Indiana? And we'd like to do more grants to higher education institutions for retaining graduates and to do more of those programs if we have successful pilots. More research needs to be done. One in particular is looking at college students and surveying them on the front end and the back end as far as their perception of Indiana and their retention, and see if we've moved the needle, and then survey those college graduates who've gone somewhere else and find out why. Okay, how did I do? Sorry about that. Didn't quite do it, but thank you for your time. I would hope you understand that we can be an income generator for the state. We've got to raise the perception of the state. If we don't, we're going to be in 10 years where we're sitting right now. Nobody knowing Indiana, nobody willing to come here. The key is going to be for talent to say, I want to intentionally come to Indiana to work. They're doing that in other states that are outspending us to tell their story. We got to get them to do that here. And that's going to be our real measure of success when people say, yes, Indiana's my choice. And then our graduates want to stay in Indiana because they understand where it is instead of going back home. Now, I'm not sure we can stop our own Hoosiers from wanting to experience somewhere else. I mean, I think that's the curiosity, but if we can show them enough of the state and build that Hoosier pride enough, we can be Texas. You can't get a Texan out of Texas for very long. They always want to go back, and I think we can do that here in Indiana as well. So thank you for your time. I'm happy to answer any questions, but I know it's been a long day for all of you.
Thank you.
Thank you.
All right, thank you, Mr. Chairman. Just briefly, you don't have to answer me now. I like your website, except for the fact, going on the Visit Indiana, then you go to move in. I'm not sure if I were moving here, I would know what that means.
Yeah.
Then you go to move in and you go down the thing to veterans. And then I just went on twice, and you show rides, you show fun things to do. But if I'm a veteran, we've passed so many in the short time I've been here, programs, benefits for veterans, former service members, whether it's free college for their children, et cetera. And that, in my opinion, should be top of mind. And so I have to scroll all the way down to figure out where that is. And then, unfortunately, when I clicked on the link, it doesn't work.
Interesting. Thank you for that feedback. In fact, that's been an issue. We're still working on getting this perfect, but I agree with you 100%. We can't find those things quick enough.
And the point is, we have been told repeatedly that the reason why we pass so many of these veteran programs, if you will, veteran benefit programs, is because that's a way to attract them to our state. So that should be its own headline, because it's millions and millions of dollars that we're spending in that space. And if they don't know we're offering it, then it's not an attraction
Right.
at all. Thank you.
That's a good point. Good point.
All right, thank you.
You're welcome. Thank you.
Next, we have Auditor Klutz.
We're gonna go really fast, so we can get to the questions. All right, I got this. I'm gonna talk for 3 minutes, okay? I know. So I do agree in investing, I love the creativity. It does cost a little bit more money, though, that just comes out of their office when they spend money, but that's okay. I'm happy to continue to write all the paychecks and perform grant compliance and all of that for these programs, because I do believe they do add value for our whole state. But committee, thank you for inviting me here this afternoon and allowing me to come. I'm excited to get started on the next budget year. It'll be my second term and last. And I'm excited for all the things that we still get to do. I plan on reading my letter, making a few comments, and opening it up. I'm reading my letter for the record. Dear Chairman Mishler and Budget Committee members, please find attached the Auditor of State's request for the fiscal 2024 and 2025 biennium. We are requesting an increase in our appropriation to improve upon the competencies and reporting of Indiana's financial systems. My team has continued to make major improvements to the state's financial and payroll systems and processes since 2017, when I assumed office. We are not finished and continue to find opportunities to improve upon the people, the data, the processes that collectively make up Indiana's financial backbone. Some of these opportunities we can offset with cost savings in other areas. For those opportunities that cannot be offset, I am respectfully asking your consideration for the additional appropriations as follows. For accounting and reporting financial compliance, an additional $550,000. Although Indiana has received an unmodified opinion, that's basically a perfect opinion, annually from our independent auditors for financial statements, we have observed opportunities to improve compliance and reporting across all spectrums of Indiana's financial system, especially in accounting for and reporting on federal expenditures. The funding increase would be used to increase personnel and training within my office accounting and reporting division. The additional 4 to 6 employees would focus on compliance with governmental accounting standards, reporting requirements for federal funding, and on internal control documentation and testing. Currently, amongst all states, we rank 45 out of 50 on how many employees we have working on the state's financial reporting and compliance, with those states ranked lower having significantly less population, employees, and revenue. Amongst our top 10 state peers with similar populations, employees, and total revenue, we rank last in the number of resources we invest in financial reporting and compliance. And I have Exhibit A that I'll walk through in a second. This is relevant only in that we are not asking for Indiana to spend more or even as much as other states, but instead consider it an investment for our taxpayers and stakeholders, as Indiana has room for improvement across all agencies in this area, and AOS wants to facilitate this improvement. My second request is for a statewide financial management training program. This funding would be used to hire a training coordinator within my office to develop payroll and accounting and accounts payable annual training for agency, payroll, and financial people in person and ongoing when there is turnover. It basically comes down to data in, data out. As good as the data that goes in is as good as the data and reporting going out, and we see that there is a need to coordinate this training. And last but not least, a supplemental timekeeping system support. The state is in the process of implementing a supplemental timekeeping system to assist our largest agencies with human resource absence management, including providing schedules, coverage, and overtime tracking. This is very useful for large state agencies, including the Department of Correction and Family and Social Services. The system can also benefit smaller agency management and employees by automatically calculating time worked from punching in and out from the employee's electronic device. My office sees the benefits of this system, and once implemented, we will, with this appropriation, provide level Tier 1 support to state agencies who choose to implement this system. I appreciate the committee and the budget agency, as well as the legislature's willingness to support my office and Indiana's financial system. I've also included a copy of our previous transmittal letter outlining our ability to operate without additional funding the past 2 years, as well as outlining some of our previous accomplishments. Yes, we were able to implement that payroll system that seemed like I was in front of you all the time for. With that, I'm going to switch to Exhibit A, and that includes 3 things I want to talk about. The first is, it's a list of our top 10 peers, and I've basically grouped in a similar fashion ones with similar population, 5 to 10 million, full-time state employees, 10 to 50,000, and total revenue, 15 to 75 billion per year. And I have the state listed. I have the comptroller's salary, and I'll get into that. The comptroller's office full-time FTEs, and then specifically what I am asking for in my request is the number of employees those offices have that deal directly with the financial reporting and compliance aspect. And that is where we rank last amongst our peers. And I brought the booklet in case you do want to extend the evening. I am available and can answer questions because there's lots more data in that as well. 2 things I want to point out. One is you'll see the word comptroller up in the title. You'll also see comptroller salary, comptroller FTEs. One item I'm going to try to do legislatively this year is switch my name from Auditor of State to State Comptroller. And I understand that that might have been a constitutional change, but currently Senator Holdman and LSA think you might be able to do it with a statutory change, like a doing business as. I have no idea how that might work, but I do know that I spend a lot of time telling people I don't perform audits for the state of Indiana. Instead, I'm the Chief Financial Officer. And the other item is the comptroller's salary. I am the first CPA to hold my position, and instead of changing the requirements to hold the office, I think it might be a good idea for the next person who holds this office, not me, to incentivize them to hold a CPA license by giving them a credit of a certain amount of money. I think we're going to have a bill that has $15,000 per quarter for every quarter they hold an active CPA license, just to incentivize the different people that might come after me to take the job. And that is a comparison of those salaries. I am prepared to talk about automatic taxpayer refunds. If you would like to talk about them, they have been a burden on my office, as they were a back burner issue because we have so many other things that we're always dealing with. I'm happy to give money back, but think this would be the 3rd one in a row. And luckily, we were able to put the first 2 on one check, but it was a big lift. We had to outsource. It was 2 times the amount of checks my office processes in a year, but we can't outsource the back end of all that. The rewrites, the reconciliations, the outstanding checks, the escheatment to the Attorney General's office as it comes. And so I've got some information on that. I also have some information on local road funding in case you have any questions. And if we don't get to them because it's late, you're welcome to contact our office and we would be happy to talk about them. Thank you.
Questions?
Thank you. Thank you very much, Mr. Chairman. I would like to know the dollar amount of returned taxpayer refunds and how many numbers of checks, individual accounts that was, and do they all escheat to the Attorney General's unclaimed funds?
So eventually, the first thing is they're all contacting our office and we're trying to get them out. We were getting them out in 2 weeks. Now it's up to 10 weeks because they keep piling it up. I do have the number of returned checks. So we have unreconciled checks. Well, of the 1.5 that we issued originally, 1.5 4 were paid. 3,300 have been reissued, 1,400 have been canceled, 146,000 are unreconciled. But that number is just going to grow, in my opinion, as there's still, the 146 that are unreconciled are just ones that are going to wait, basically, some of them are going to wait for the whole couple of years before they get escheated, and then that'll go to unclaimed property. And so then we'll wait, and we have to send a letter to each one of them at that point. None of those costs have been included. My office has spent about $150,000 just in labor cost, not including the $1 million we spent on the contract to print and mail the checks.
Anyone else? Senator Dora.
Thank you. Thank you for your service. I appreciate you. One quick question. You brought the infrastructure. I'm working with a couple of senators on trying to legislatively make a couple of fixes to the formula. Has the population count error or issue from a couple of years ago been corrected for Marion County, or is it still pending?
So I believe what you were referring to is the inclusion of areas in Marion County that are covered by the Indianapolis Fire District.
Yes.
And so I will say that I loved the opportunity to look at that statute, and I was willing to make a change, but based upon my previous look, I don't want to call it an error. Because I think what happened was when Unigov or the Indianapolis went to Marion County, the road funding formula, the road funding that's passed out to cities and towns is like one bucket, and they all share in proportion. And so I think at the time, they thought, oh, they should freeze the boundaries of the Indianapolis Fire District so that all the other cities in town, like Fort Wayne and Evansville, don't get hit. But I don't think they were thinking that during all the years after that, that cities and towns can annex, and they were throwing the proportion off so that Indianapolis collected a lot less than they had been collecting. And so it was an easy fix, and just looking at the law and looking at intent, and we made that change, and we've been operating on that ever since.
Was that change made in 18, 19?
19 or 20, I
19 or
believe.
20,
But
so it's
I
recent.
do have somebody here specifically who knows.
I really appreciate you for that update. Yeah.
Yeah.
Hi, sorry.
Hello, how
Courtney
are you?
Everett. That change was made January 1st, 2020.
Thank you. Excellent. I appreciate that change has been made, and I'm working with Senator Aaron Freeman and others on looking at the population count, so would love to share with you a draft of that to get your thoughts. And I think, so anyways, I'll share your draft with you. I appreciate you for what you do. Thank you both.
Thank you.
Thank you. Thank you, Mr. Chairman.
Anyone else? All right. Thank you. And the last for the
Did you see
day.
what time it was?
I know, you saved us 5 minutes. We'll remember that when we do the budget.
It's a reverse.
Yeah. Attorney General's office, I just got a message that our Attorney General is home sick. So Larry Hopkins will do the presentation. All right, Larry, whenever you're ready.
All right, can you hear me okay? All right. As you mentioned, we're missing the Attorney General today, so I'm going to read a short statement that he was going to read. Thank you, Chairman Mishler and members of the committee. My name is Larry Hopkins, and I'm the Chief Administrative Officer here in the Attorney General's office, and with me today is Ethan Simcox, our Acting Finance Director. AG Rakita had intended to be here today, but came down with an illness yesterday and was forced to cancel all of his public events the past 2 days. He did not want to spread his sickness to anyone else and decided it was best to cancel all events. He did indicate that if any of you wanted to reach him by phone during the hearing to answer any questions, he would be glad to take your call, although I can tell you his voice is very congested right now. He also indicated that he would be glad to meet with any of you about the budget individually before the start of the session. We do appreciate the budget agency working with us to schedule this time slot for our presentation so that the AG would have otherwise been here. So thank you, Zach, for that, even though it didn't work out. I have a brief opening statement to make, and then we'll run through a PowerPoint presentation that highlights duties of the office, who we represent, areas of focus. We will discuss impacts to the budget based on current employment market conditions and attempt to address those impacts with additional outside counsel engagement and a revised salary schedule based off of the State Personnel Department's recently announced and implemented salary grades. The past 2 years have presented challenging period for the office, including high-profile litigation on cases involving opioids, abortion, COVID impacts, big tech, constitutional disputes, an array of state sovereignty and federal overreach issues coming out of the Biden administration. Our lawyers and staff have also combated an increasingly sophisticated and complex cadre of scams, schemes, and deceptions designed to separate Indiana citizens from their money, their ID, and their peace of mind. Considering all of that, the office has come through in good shape, no worse for the wear, and prepared to meet the challenges that lie ahead during the next biennium. With that in mind, we come before you today facing a budget dilemma that needs your review and attention. Market conditions have created a demand for litigation attorneys far greater than the office has ever seen in the past. Currently, we have 17 Deputy Attorney General vacancies in the litigation division alone, about a 50% vacancy rate. The conditions creating this challenge are varied but are related to lifestyle changes coming out of COVID that folks in high workload professions are making, combined with a smaller pool of applicants completing law school and an inflationary economy driving up wages and the competition from the private sector. In short, we are losing deputy attorney generals for higher salaries at a faster rate and facing a smaller pool of potential replacements to draw from. The main consequence of this new reality has been to hire outside counsel to tackle the workload. This assistance comes at a much higher cost than was budgeted for by the prior administration. A tool the office used in the past to address the fluctuations in litigation expenses and technology needs was the Consumer Fund. It was established to cover legal expenses and educate Indiana consumers to help them avoid falling prey to false promises and making poor decisions that could affect their health, safety, and welfare. Its revenue is derived mostly from litigation settlements, fines, and fees, and generally comes in the form of a court order. The Attorney General was charged with oversight of the fund to cover litigation costs used for educating and protecting consumers. As you know, that fund was converted by the legislature during the Hill administration into the Agency Settlement Fund, with the intended use to benefit a wide array of state government needs. As a result of that change, the Office of Attorney General must make frequent augmentation requests to the state budget agency to cover financial needs that would have otherwise been covered by the old Consumer Fund. The process of drawing funds from an agency not focused, understandably so, on the immediate litigation and other office expenses can sometimes lead to delays and conflicting priorities. The budget package before you today presents an attempt to address new funding scheme contemplated under the Agency Settlement Fund and lessen the need for future augmentations by putting significant funding increases directly into the Office of Attorney General budget. As you know, the office generates annually and over time far more revenue to the state than it expends. Finally, the largest budget impact, which I highlighted earlier, involves addressing the need to have salaries adjusted to competitive levels to address inflationary pressures. Only then will the office be able to keep and maintain the professional workforce that Hoosier taxpayers deserve. A high percentage of our budget goes towards employee expenses. We have proposed a new salary schedule that addresses the office needs and results in an average across-the-board increase of 16% per employee. That level of increase matches the percentage increase that the State Personnel Department has implemented for the rest of the executive branch agencies. So now we'll walk through a short PowerPoint presentation that kind of talks about the areas of the office. Okay, so this covers the major divisions of the office. For those that are not familiar with it, we have the advisory division, appeals, litigation, complex litigation. Complex litigation is usually where many of the multi-state cases are handled, or we are working with other states on opioids or big tech related type cases. Solicitor General is involved obviously in constitutional cases, but also handles a lot of the amicus briefs and the issues that we have involving state sovereignty that the office becomes involved in. Then we have the Medicaid Fraud Control Unit and unclaimed property. This slide represents kind of a listing of all the state agencies that we currently have cases with. Gives you some idea of the great diversity of the types of cases that we're involved with and which agencies have how many cases and where we spend a lot of our time. As you can see, the Office of Attorney General is intertwined with most of state government in some form or another through legal representation. The next slide focuses on what's become the sort of evolving role of attorney generals over the last decade. There is a lot of collaboration between all the states now on amicus briefs and sign-on letters. This shows you the number of requests that we receive each year and the number that we have accepted. And every request that we get involves a review of that request, what the legal issues are, what the legal policy inferences are, whether we would be joining it with a smaller group or a larger group of states. And the bottom chart in green represents those are heat maps to show you kind of which states we've signed on as partners with on more issues than others. A lot of times the amicus briefs are filed at the highest courts, either at the U.S. Supreme Court, the state Supreme Court, or appellate courts. And then on the right is a column that lists kind of the topics and areas where we receive these requests, what they involve, and the issues. The next slide focuses on the opioid settlements, since that's been in the news a lot this year. It just gives you kind of a rundown of the settlements that have occurred, some that we've announced, some that are in bankruptcy. One that's not listed on there is the Purdue Pharma, which will be a big one, but that case is mired in bankruptcy right now, so nothing may break on it for the next 2 years. And then, of course, pending settlements at the bottom, we mentioned Walgreens and CVS. We just announced a settlement this week on those. The next slide focuses on lawsuits against big tech companies that generally have to do with either free speech issues or identifying information that they contain. The TikTok one recently announced involves kind of misleading consumer information and what they claim their site projects, and also the security of the data that they collect that is available to the Chinese Communist Party. We also have some pending investigations that are underway that are listed there as well. Litigation status on robocalls. This is an area where Indiana is a leader among the nation. We're involved in a really big case that began actually over a year ago, involving some companies in California that are working with companies in Southeast Asia on sending calls over to the United States. We're the leader of a 50-state task force, and we also have interest from Canadian and United Kingdom agencies involved in our effort. The next slide focuses on data breach and identity theft. It gives you some idea of the rapid increase in these type of cases that we are seeing. It's become really a new area of the office that's going to require a lot of focus going forward, especially the ID theft and just the overall issue of securing consumer data. This slide focuses a little bit on our technology requirements. We're in the process of implementing a new case management system. We had some issues with a prior vendor that was contracted under the prior administration who walked off the job, delayed the implementation of this, and we had to get a new vendor involved, and it gives you some idea of what we're looking at. The enterprise content management at the bottom is a new document management system that will be focused on as we complete the case management system. The next slide gives you some idea of the amount of revenue the office brings into the state, where it comes from, reflects the fact that we bring in a little over 5 times the amount of revenue that we expend. We also do collections on behalf of a lot of state agencies. And this slide focuses on kind of the implications of staffing shortages and what we've had to do to compensate for that with outside counsel. And then finally, this last slide focuses on our salary structure. As I mentioned, what we have done so far is work with SPD after they made the announcement of their new salary schedule. They've kind of shared information with us after the fact, and we've tried to align our positions with their positions where there are matches. Some cases there weren't good matches, and we had to go outside and pull salary information from the Bureau of Labor Statistics and other sources to come up with a new salary schedule for the office, with each position falling into new grades that we have created. We've really crammed a lot of work into this effort over the last couple of weeks. Part of the reason we've got some last minute changes to our change packages relate to the salary information. We were trying to get that finalized last Friday when we submitted it, submitted our final change package revisions to the budget agency, and we had to redo some of those yesterday, so that's why you're getting a late update from us late last night. But we now have 100% of our positions covered. It involves a 5% COLA increase for all employees across the board, and then additional salary adjustments to most of the office, but there are some positions that won't see a salary adjustment except for the COLA. But the overall percentage increase matches what SPD did, and that's kind of our goal, to stay within those parameters. And that's it for the PowerPoint. Thank you.
I will say this, text works great. He said he can't speak real well, but he can text. So
Okay.
I set up my meeting, I'm working on my meeting with him.
Okay.
Any questions from the committee? Senator Cadora.
Mr. Chair, you limited me to 2, and I appreciate it. I'll stick with 2. No, I'll stick with 2. I'm not getting my bills passed anyway, so. I want to thank the AG's office for one thing. His office was very helpful. There was out-of-state negligent landlord, corporate landlord, JPC I reached out to the AG's office. They owned multiple properties in the city and the state, and I appreciate the AG's work on this, and I'm working on a piece of legislation that expands the AG's office authority based on his recommendations, and I'm working with Chase over the homeowners protection unit on this issue. On the flip side, there are a couple of things that I want, from a transparency perspective for the taxpayers, I'd love to get your answers to two questions. The first, the media reported a while back that the AG traveled to the Mexican border on a state-funded trip. And then he showed up later at a political campaign, and the office never issued a clarification on the reason why the Indiana AG has to be by the southern border to investigate illegal immigration. So I think from a transparency perspective, do you have any thoughts of why would the AG need state-funded taxpayer dollars to conduct such trips, which are questionable by the public sometimes?
Well, I think the answer I would provide for you today is that immigration in general, illegal immigration, is an issue for all 50 states. It's not just relegated to the border states. And from our perspective, we're working with a lot of the border states on ways to combat illegal immigration and also to determine the actual effects of it for our state. And we felt like in that particular instance, there was a trip that was set up by the Texas Attorney General's office to take other AGs to the border to kind of have a firsthand look of what was going on. And we participated in that trip along with several other AG offices. Events that, side trips that the Attorney General may have taken on the way back were paid for by him personally, so they weren't covered by the state expenses.
I appreciate the answer. The second and final question, for the taxpayers to know how much the office spends on different things, including lawsuits that were lost, including internal, or lawsuits against the governor's office as far as one of the bills about the powers of the governor to call the General Assembly back. Do you have a report, or can you send me the information about the lawsuits that we filed as a state under the AG's office, but were not successful? I know I'm not suggesting that we as a state will win every single case, but at least there were specific cases. Again, in my district, constituents asked, why are we doing this? And I want to be supportive of your office because your office is a constitutional office that supports the state. You play a critical role. We want to invest in your staff. We want you to focus on the professional work that you do every single day. But some of these things that tend to come to my constituents as more politically motivated than professionally motivated, they ask why my taxpayer dollars are paying for this. So I would like to see a report of lawsuits that the AG's office filed and we did not lose, and we lost as a state. I just want to get an assessment of how much we paid for those.
Okay, just to clarify a little bit, many of the lawsuits that we are involved in are just conducted with our own staff. We don't hire outside counsel for those. So the only expense to the state is the salaries that staff are paid. So in that respect, I don't know that we have a way to calculate what
how much time they spent on
for lawsuits that we lose versus ones that we win if there's no outside counsel involved, because it's all staff time and each individual lawyer may be working anywhere from 20 to 200 cases depending on what area of the office they're in. So it'd be hard really to come up with a cost figure for winning and losing cases.
Well, I appreciate the answer, but I think, again, I'm not suggesting that you're a private entity law firm that charges by billing hours, but I think to the taxpayers, when we hold each agency accountable to data-driven performance, it might be helpful when we are able to say, the same way that you are able to say, we collected settlement dollars on behalf of Hoosiers and all that, the same way we celebrate wins, it's very important to see how much we spent on things that we lost. But I'll be more than happy to email you a couple of suggestions of how to think through that. Again, for the good work that you do that I agree with, I appreciate you and your staff. I know it's not an easy job. Thank you.
Thank you.
Any other questions? I think we're just worn out, Larry.
Yeah. You've had a long
You lucked
day.
out being last, didn't you?
Thank you.
Well, hey, thank you. And I just text Todd, but yeah, I hope he's feeling better. So,
Okay.
with that said, I guess we'll adjourn until 10 a.m. tomorrow. We'll be